Okay, so welcome everyone to our final session of this Lymph Flow Yoga Wellness Program. So, as you all know, today is our community offering day. So, these are the past 6 weeks of our topics. So, as you all know, you have the recordings to all of these. And today is our final session where we're going to welcome many new people to our community to share their offerings. So, just for my participants, I created, you might have seen already, but a document with all of the recordings from this program. So all the program content. So it's all in one spot for you. So you no longer have to go to your email. You can just save this document to your computer. And if you ever lose it at any time, just email me and I'll send it to you again. But basically this has all of the educational topics. So all the videos from this program, as well as all of your chair yoga recordings, the floor yoga recordings, the Facebook group link, the participant contact list, as well as all of the community that's coming to join today, a Google Doc with all of their offerings, as well as the diagram of all the many things that we learned throughout this program. So it'll all be in one spot for you, and you have access to all this information for forever, for as long as you need it. So, and continue to go back to it, kind of digest the material over and over again. And again, if you lose it at any point, just shoot me an email and I'll send it back to you. Just a few reminders before we begin. So this program or today will be recorded. So if you would not like your face, your beautiful faces to be recorded, then just use the chat function and I'll monitor that for questions. And you can ask questions at any time. So this is very casual yet professional, and we can kind of talk and have a nice conversation and build off of that. So, and then one more reminder is that I have a brief survey at the end of class that I'll send all of you and for my participants in the program. And that's basically just a way to allow me to continue to make this program better for all of you. So it probably will only take you a couple minutes or so to do, but just that's a little reminder as well. So welcome. I'm so happy that you all are here. And so basically how today's going to go is that every 15 minutes we have someone new joining. And these are people that I've handpicked, as you all know. These are all people who I really trust in the lymphatic community. These are people who I really respect and know that you're all going to connect with. So basically what I'm going to do is every 15 minutes, I'll call upon our next guest. And then I'll ask them just to share their story, kind of why they do what they do, any offerings that they have, and then how you all can connect with them. So that's the flow of everything. And then we'll save time for questions for each person, maybe one or two questions. And again, you can use the chat function to ask. And so let's begin. Let's see, what time is it here? We're a little bit early, but I think we have our first guests already on here, Ashley and Sean. So if you want to unmute yourselves now.
All right. Hey, guys. Well, my name is Ashley Fisher, and I am one of the hosts of the Lipedema Mamas podcast. Sean is the other host. She's here too. I'll start by just sharing a little bit of our story, and then I'll let Sean talk about the podcast. So Sean and I met on Instagram because we live in the world of social media. And she had this amazing account going where she shared every single day about her journey with lipedema. And in January of 2023, I received my diagnosis. And so, of course, I was scouring the internet to find out what is lipedema and what do you do once you know that you have it. And so Sean and I started messaging back and forth. We realized that we're both moms of many, many children, and we only live a couple of hours apart. And so we met and we both shared this heart for women with lipedema. And we knew that we wanted to do something to help the community. And that is where the podcast was born. So, Sean, you talk about that.
Okay. Yeah. Hey guys. Thanks, Babz. Yeah, I'm Sean, and I have stage 2, or was diagnosed with stage 2 lipedema and lymphedema. Um, and yeah, Ashley and I started a podcast, I guess a little over a year ago, and we've put out a new episode weekly for over a year. It's been a labor of love, but it's also been really healing, and there's a lot of great information. So our goal with the podcast is to have professionals on, such as surgeons. Babz did an episode with us. We've had Karen Herbst on the show. So a lot of really great professional resources. And then we also have patient advocates, or just patients that have lipedema and lymphedema, sharing their stories just so that others can hear it. And so many times we'll have a patient on and they'll say something and it's like, oh, wow, light bulb moment. Like we feel, we've experienced that also. So the patient stories are really just as valuable as the professional episodes. And then occasionally Ashley and I will like kind of rotate in just something fun, or just kind of sharing about our lives. But we feel like it's a great resource for the community. And you can find us on Spotify or Apple Podcasts right now. We also have an Instagram page where you guys can find us. And on that page, Lipedema Mamas Podcast, we share little snippets of the episodes, so you can kind of get just an idea of what that week's episode was about, and then we'll share who the guest was for the week. So it's a good resource as well.
Yeah, it's been such a cool, like she said, definitely a labor of love. And we're, as of this point, we're nearing somewhere around 130,000 listens in just about a year, which is amazing because it speaks to the need, right? It speaks to how many women are out there struggling with these lymphatic issues, and they felt so alone. That's so much of our story. We felt alone for so long. And it's been amazing to provide something to help bridge that gap and bring women together. We've had women message us and say that they found the podcast, and then therefore they realized that lipedema was what they were dealing with, which is just amazing. It's amazing. So, out of that, Sean and I just, again, we love this community so much. We always say that we think this community of women is the best that there is. And we were brainstorming on different ways that we could continue to help. And one of the big things that we saw was a kind of a common thread with women that realize that they have lipedema is they go through this time period of, okay, so lipedema is a thing, now what? Right. And so we spend hours, weeks, months scouring the internet and trying to figure out, okay, how do I manage this disease? And there's so many opinions out there, right? And sometimes it can be hard to figure out what's right, what's not right, what's right, good information, bad information. And so we wanted to expedite that time period for women rather than having to spend months trying to figure it out on their own, on how to manage this disease. We thought, what if we put together an online course that talks about all of the conservative therapies that you can utilize to manage lipedema? And we didn't want it to just be our voices. Through the podcast, we've been connected, like Sean was saying, to so many wonderful names in the community. Catherine Sayo, Karen Herbst, some wonderful surgeons, some wonderful therapists like Babz. And we wanted to pull those voices in, the people that we have grown to know and love and trust. We wanted to like serve that up on a platter to this community, and especially to those who are just finding out that they have lipedema. So we created a course. It is 66 modules, a labor of love for sure, all about how to manage lipedema conservatively. And this is something that you can go at your own pace. You can take it at little bite-sized snippets at a time, or you can go all in and, take it all in at one time if you want to. But you'll hear from several different experts in the community, like Babz. She was kind enough to offer something for our course members. And let's see, it covers everything from nutrition with a professional nutritionist, lymphatics from Leah Levitan, Lymph Love Club. Let's see, who else? I know I'm forgetting like several. Who am I forgetting? Um, oh gosh, it is
Oh,
escaping me.
Virginia
Vir- Virginia, and she talks all about hormones, which is,
hormones.
well, it's fabulous. And there's others too, and I'm forgetting, so forgive me those that are like, hello. But anyway, so we've got all of these modules available. There's even little quizzes along the way to kind of help check, like, am I understanding the information? And by the end of it, you just have a really good idea of, okay, here's how I can manage this disease. And we talk about how, with conservative management, it's not about, we're presenting the buffet, and we never want anyone to feel like they have to do every single one of these conservative therapies, but it's about choosing the ones that fit well for your life and doing those few things really consistently. And so, with that, we also have an online community called The Circle. And this is a membership based community where we just get in there and we just talk freely and openly. It's a safe place. Sean and I are so just, it's important to us that it's just a safe place to come ask your questions and to come share with other women who have this disease. And so there's lots of different places in the group where you can talk about if you come across a funny meme or a GIF. Plop it in there. If you come across a really cool piece of research in dealing with lipedema, you plop it in there. And once a week, we have a live Q&A with Sean and I where you just come with your questions and we just talk. And it's honestly become like a support group that's small enough right now that we can just hear one another and hear our stories and offer support. And we're also bringing professionals into those lives as well. So far we've had Dr. Catherine Sayo come in, which was amazing. We've had Virginia Zulu come in and answer hormone questions. So it's kind of just a sweet spot to come in and get face to face with some of these wonderful women in the community and ask questions. And so for today, through the end of the month, what we're offering for this group is 20% off of that online conservative management course and using the code FLOW, which Babz, thank you so much for putting that in there because I sent her that graphic. So last minute, thank you. And then we'd love to offer you all your first month in the circle for free. Use the code FLOW CIRCLE. And you're going to go to www.lipedemacourses.com. And and we would love to see everybody there. It's been such a cool thing.
Thank you both so much. I feel like I think the most important thing that you've even mentioned is that through people listening to your podcast, they're actually finding out that they might have this. When you said that, I was like, that is really key, right? Because we put
Yeah.
this information out there to say, okay, this is your stories. You both are vulnerable enough to share exactly what you went through. And so if anyone isn't following them on Instagram or social media, you really should, because you see the raw, the beautiful version of like what you both as patients, as moms, as people are going through with this diagnosis. And I think that makes it real, but it also gives like these people who are like, maybe I have that, maybe I don't, a really safe spot, like you said, to come to and to talk things out and to feel that support. So thank you both for doing this for the lipedema community. It's important.
Oh, it's an honor.
Thank you.
Yeah. Does anyone have any questions right off the bat? Yeah, Andrea, do you want to ask your question, or you can write in the chat, just reminding that everyone that it's recorded.
Yeah, I just have a question because I'm in this new stage of experiencing what lipedema is and not formally diagnosed here in Canada, unfortunately. But did you guys ever experience like flares of pain? Like I at baseline struggle since giving birth like 18 months ago with like flares of pain, but I also struggle, like I can't stand on my feet for more than an hour, but then I go through these flares of like 6 weeks of more pain, and doctors are also wondering like if I have other like potentially like a fibro, but I just wondered if it was more of the lipedema picture than other diagnoses.
Yeah, I would maybe hold the two and kind of, see. I think being, I know we consider ourselves like we should be over it, right? We had baby so many months ago, but your body is going through so much right now that it could be a little bit of both. I know for me, it took me a while after my kiddos to really start feeling somewhat normal, and new things would pop up that didn't before having baby, right? So the first thing that comes to my mind is just inflammation in general. And so taking a look at when those flares happen, ask yourself, okay, what did I eat anything different? Or is maybe this food that was wonderful for me before, maybe it's not like jiving with me now? And not to say cut that out completely, but just kind of take a look at these different things that might be causing inflammation. And
Yeah.
then just hold those two things, lipedema and the fibro, kind of hand in hand for now. And just kind of watch. I know that's sort of such a general answer, but there were times, after having my kids where I had the same thing. It's like, dang, like, man, I'm like hurting more, or I used to could be on my feet all day and now I can't. What the heck? And so just kind of remain really curious about all of it. And, the lipedema, it does progress at times of hormone influx, right? So you might be in the midst of a flare since your body is still trying to even out after all those hormones with baby. So, Sean, I don't know if you had that same experience or not.
No, but that's what I was going to say. Like, it's common for progression, that can happen at pregnancy or menopause, just different hormonal changes like that. So maybe that's kind of what you're experiencing. I know that it's really common that, like you said, not being able to stand. And I will have flares, but they don't last, like, I think you said, weeks at a time. I can't say it's like that. Mine are much more up and down. But I don't see why that couldn't be just different for you. So it sounds like Ashley said, like kind of looking at both and just being really curious about both potential diagnoses.
Yeah.
Okay, thank you.
I think that was great advice of kind of monitoring what's going on, maybe what your flares might be, or even though that's really hard because in the moment you're like, I have pain and why is this happening? But maybe even trying to be more and like take a step away from it and like logically think about it or write it down, like, all right, I had that pizza and that glass of wine, not saying you're doing this, but like, and okay, the next 3 days I was not feeling good. Or so I totally agree with that. But I would almost like encourage you to try to have like a list split down the middle of like, all right, these things flare me up. I notice them, but also these things really help me. So I went for a walk that might help me, or I did some dry brushing, or I did some lymph drainage, and like maybe target down like your 5 top things that you're like, all right, I'm feeling like a lot of pain, a lot of stuck energy fluid, but I know these 5 things might help. And like kind of just to give you like that kind of flip flop back, that yin and yang kind of like, this really hurts me, but well, this really helps me.
Yeah.
Yeah, for sure.
Yeah.
I am at Babz, as you know, I'm also an OT. So I've like come at it from all lenses and also have eliminated pretty much everything from my diet and have come like holistically approached it too. So I just wondered what the norm for like a lipedema feeling, I guess, is, because I think medically I'm a little bit more complex and not straightforward. But
there's also there's a new group in Canada. You may have seen this already. They're fairly new. Yeah, Lipedema Canada, and I think that's some great. They're trying really hard to put together like great resources for you guys.
Yeah, no, I'm super pumped about that group.
Okay. I see another question in the chat. Are you finding that the medical community is very aware of this condition in the US? Is this condition difficult to diagnose?
That's a good question. So, 2 things. This condition is not difficult to diagnose at all. You take family history, you take your symptoms, and the physical look of things, and you have a diagnosis. And what makes it complicated is that we still don't have this getting taught in medical school. It's starting though. June was Lipedema Awareness Month, and I feel like lipedema is catching on more and more all the time, but we have a lot of work to do. And so as these practitioners are learning, um, they're diagnosing my husband was the one that found the term lipedema on Instagram, and he's the one that brought it to me. He's a nurse practitioner. Now that we've been going through this whole process and lifestyle change and all of that, he's been able to diagnose people in our hometown, several women, because now he knows about it. And so, my big key advice there is when you're thinking about going to your PCP to maybe get a diagnosis, is bring literature with you. And you can get those resources from places like the Lipedema Foundation. They have printable resources that you can take with you that are scientific and medically backed, so that your practitioner, who very well might tell you they've never heard of lipedema before, they'll say lymphedema, and like, no. You can give them that literature, and it will definitely help. I would always say take something with you, as opposed to just going in cold and saying, I've got this thing that I saw on Instagram called lipedema. I wouldn't go at it from that point. So easy to diagnose. We just need more in the medical field to understand and know about it. And we're getting there.
I completely agree. Having that medical paper or physical paper will have a big impact. That's super helpful. And that's helpful to know about the Lipedema Foundation too, that there's content that you could bring.
Yes. Oh, and Lipedema Simplified has put out a research paper that they worked a few years on, and it is they're going to have like a 1 or 2 pager that you can print and you can take to your practitioner as well. So there's lots of really good printable resources out there to take with you that will help.
That's awesome. Okay, I see one more question, and we have enough time, so this is good. How to tell if you have lipedema versus just being overweight?
That's a good question. I think there's a lot of, you've seen like the Venn diagram of the two, and lipedema tissue is a lot different than our regular fat tissue, and it is possible to have lipedema and be overweight at the same time in conjunction with one another. But lipedema tissue is often nodular. It can be sand-like to rice grain like to little pebbles. You can usually kind of feel it. Women with lipedema will be like, look, feel my arm. But the tissue is painful. Like if your cat jumps in your lap and that's not normal, regular fat tissue. That's often points to lipedema, easy bruising, a sense of heaviness that even if we are overweight, we feel as if we're maybe 4 or 5 times our actual weight. That tissue is very, very dense. Whereas obesity or just being overweight, you're not going to have those tie-ins. You're not going to have the easy bruising or that tenderness. And lipedema tissue is very, very challenging to lose naturally with diet and exercise. I'm not going to say it's an impossibility, but it is much, much harder. Whereas typical, regular fat tissue, we can lose with diet, exercise, calorie deficit, that kind of thing. Sean, am I missing anything, you think?
No, I mean, just the shape and the disproportion.
Yeah.
Did you mention that?
No.
Yeah,
So, yeah.
so it's really common that your legs would be really disproportionate to your upper body. Like for a lot of us, we'll wear a different size top than we would pants, like by, multiple size different. And then it's also pretty commonly present in arms, so legs and arms, but usually like your torso would be smaller than the rest of your body. There's just a disproportion there.
That's great. That's very helpful. Any last questions? Well, I'm glad that was recorded, because that was a ton of great information for this community. So I really appreciate you both, Ashley and Shanta. Thank you so much for coming on, and I'll make sure that everyone gets this updated slide, and that in the Google Doc, all of your contact information is there. So thank you again for coming and for creating such a safe and supportive and knowledgeable space for the lipedema community. Thank you.
Thank you,
Thank you.
Babz. We appreciate you.
Thanks. Okay. How's everyone doing so far? Doing good?
Good.
Awesome. Hi, Joe.
How you doing?
Welcome.
Thank you.
Okay. So as we transition between each of our wonderful members, I want to take a minute to take some breaths and do a little movement because I have been preaching this whole past 6 weeks to move and to breathe and to not be stagnant. So let's just place our feet onto the ground wherever you are. And then feel free to close your eyes and just allow yourself just to settle for a moment. And then we'll take a slow breath in through the nose. Exhale, let the air out, go through the mouth. Slow breath in. And slow breath out. And then we'll draw our shoulders up towards our ears on the inhale, exhale, back and down. So just opening up our chest here, taking some breaths as we do this. Okay, now we're ready. And feel free throughout this day to, drink your coffee, your tea, stand up throughout the day, move around. So, take those principles from our program into today as well. So, okay, so our next guests are going to be talking about rebounding. Claire, are you here? Maybe not yet. Not yet. That's okay. We'll breathe some more. We can do that. Let me make sure that they're not. We'll wait a few moments. Does anyone want to share if they have rebounded before or if they do this in a daily practice? Okay, I see some hands. Awesome. Okay. I see a few of you. Do you find that it's helpful?
Babz,
Yes. Hi, Robin.
I find the rebounding is just awesome, especially when, for any reason, if you can't walk far, you can rebound and you get, at least I get the same amount of, or the same feeling of just being rejuvenated after a good walk. And it really helps.
Awesome. How long would you say you do it for?
When I first started, 3 minutes, and then I have gradually built up I'm at 12 minutes now. And it's a long, gradual build up for me. And, because I can't walk very far distance wise, maybe a mile and a half in a stretch. And it's mainly because of arthritis. But, it's the best. It's one of the best things, thanks to all of this and education that I've come across. So it's really good.
Babz, I rebound too.
You do.
I do. And they say that 15 minutes on the trampoline is the equivalent of 45-minute walk.
Mm.
So that's very motivating for me, especially winter months where I do not want to be out in the cold. So I really like it. It's a great workout, and there's lots of videos online that are beginner all the way to advanced that are helpful that I follow.
That's awesome.
Mm.
And Claire responded, she's coming on. She's jumping on right now. So wait. And I see some talk in the chat, which is awesome. Love rebounding. We have a large spring tree trampoline. Whoa. That the kids use a lot. And sometimes you can jump, walk on it. That's awesome, Amy. And Lisa said same. No bra. Yes, that's also a good thing too. I would build yourself up slowly with this, but if you aren't wearing a bra, then that will help to improve some lymphatic flow and get the tissue to pump in the central region as well. That's awesome. Okay, and I see Claire coming on.
Hello, sorry. There, we're good.
No problem. How are you?
I'm very good. Yourself?
Good. I'm so happy that you're joining. We were just having a little mini discussion about rebounding, and the good news is many people in this group are currently rebounding, so I'm excited to introduce them to you. So I'll ask you to start by just sharing your story, you and your husband, and kind of what brought you to start this.
Okay, so I have been in the fitness industry for almost 16 years now. And back in 2013, I think it was, I saw a program in England, and these ladies were all on mini trampolines. And I said to my husband, oh my goodness, we could do that. We just were looking for a class that was completely different. And we just went for it. We started out with really cheap sprung rebounders, and we thought we'd just give it a go. And literally classes just went crazy. And within 3 months, I was having to buy better equipment, more equipment. So that's how we started. I bounced through both of my pregnancies with my children, and it was just something for me. I am asthmatic, so exercise has always been quite tricky for me. I spent a lot of my younger life in hospital. So for me, rebounding has very much been something that has looked after my body. And I've loved the fact that I can do it even when I've got a cold. You know, you don't have to go crazy on the rebounder. You can have it for that lymphatic drainage. You can have it after you've been ill, whether it's rehabilitation as well, or if you want to do those full-on workouts. So we started off with the sprung rebounders. We taught on those for 6 years, and then we emigrated to Mexico. And that's when we then had the chance to get in contact with some of the bigger brands, Jump Sport, Bellicon, Leaps and Rebounds. And they sent us their rebounders and said, we'd love for you to try them. And as soon as we switched to bungee, oh my goodness, it was just so different. It was like bouncing on clouds. And I think now that's where I feel a lot more comfort in my body as well, is having that softer bounce, not necessarily a deeper bounce. You know, with a lot of the cords, they are adjustable so that you can have that firmer tension, but it's just kinder to the body, I think, from our experience. We've used many brands. We still do. We still use different companies that we can work with so that we can give our customers choice as well. And then I really started thinking about how can we make rebounding more accessible for other people, because it's always been quite a passion of mine and Scott's, my husband. We don't have the necessarily normal fitness body. We're not, you know, we haven't got a six pack. I do have cellulite on my legs. My weight has always been in my legs. That's always my area where I've struggled. For my husband, it's always around his abdominals. And we actually had a client who, her daughter has cerebral palsy. She sent us some videos of her working out, and she was on this terrible rickety trampoline. And I said to Scott, oh my goodness, like she was really going for it. She had so much energy. And it was just beautiful. It really was. And that's what kind of made me realize rebounding is for everybody. It doesn't just have to be, you know, the fit and the young. It's something that can be so inclusive, no matter, you know, what your condition is or your level of fitness. So that's when we really started trying to branch out with our workouts. I had quite an in-depth conversation with her mother, and she said, I'd love it if you could create something a little bit more specific. So we started doing a lot more low impact workouts, slower beats, And then that's when I really got into Instagram. At the time, we weren't really on social media that much. So that's when I started to meet other people in the community. And then obviously reaching out, I had some ladies that had lipedema, lymphedema. And again, we would have clients say, can you make something for your YouTube channel that is just more specific, because we just cannot find it. So again, I would have quite in-depth conversations, because I realize from the outside looking in, people will look at me and say, but you cannot relate because you don't have that condition. So if anybody has ever been in contact with me before, they know that I ask an awful lot of questions, and I want to know what is going to work for you, because for somebody that's maybe struggling with lipedema or lymphedema, you know, those movements around the trampoline, maybe moving forward and back or right to left, is not always doable. They need to keep their feet in a fixed position. So I've actually just done this morning, I created a workout, I think it was last year, rebounding for lipedema. And I went back and I do my own workouts. And I know that might sound a little bit vain, but it's because I want to remember, I want to feel, how does this make me feel? And actually recently I've been quite ill, so I haven't been able to do the type of workouts that I have been normally. So I've been going back to those lower impact rebounding classes that I have created. And it's just been really lovely, because I know it's helped so many ladies. Like, we just have to look on the comments, and it's just amazing. And it's not just people that are suffering with these conditions. It's also people that maybe just have been ill and they want something that's lower impact, or they just want a rest day, but they don't want to rest. They still move and get the lymphatic system going. So yeah, I have I answered that question, or was that a bit too in-depth?
Nope, that was absolutely perfect. That was great. Yeah, that I really enjoy your perspective on it, and that's why I wanted you to join this group, because you have this YouTube channel with these videos and you have these resources, and it's very aligned with what I do with the community too.
Yeah.
And so I would love for you to share that the link for that video for lipedema, and I can share it with my community. And
Okay, perfect.
having that option is really beneficial, because you know, like you said, there's different, with any type of exercise, there's a wide scale or range or spectrum. So having those shorter, less impact kind of classes to begin with, even. So I know many people here, and I see in the chat here, someone said, "Amen, Claire."
Oh, yay, I'm so pleased.
And then another person said, what about rebounding if you have osteoporosis of the spine?
Okay, so this again is a question we get asked quite a lot about. I would always say, I'm no physician, no doctor, you know, I just have that experience in rebounding, but I would always consult with your physician, because again, my mum has osteoarthritis, but she rebounds every single day. She's had multiple knee surgeries. She is so thin, bless her, but she's really active. And I don't really like to just say a yes or a no, because it's not really a topic that I can necessarily give that straight answer to, because again, every single person is different. But I would say quality is really important when it comes down to choosing a rebounder. It's a question I must get asked at least 10 times a day. What type of a rebounder should I go for? And from our own experience, I would say that bungees are a lot more comfortable than sprung. But then if you are struggling with balance, you might want something that has got a firmer surface. So this is where things like the stability bar comes in really well as well for helping with that balance. But there definitely is, you get what you pay for in this industry. I know in a lot of other things, you know, you can kind of go a little bit cheaper, but I would say that comfort is really important. And if you do have any issues, whether it be internally or with the bones or anything like that, then definitely do your research. If you can go to a class and maybe try out some rebounders, maybe find some people in your local area that might be doing those type of classes and look at what type of rebounders they are using. One thing I always say to our members or to anybody that contacts me personally is, I understand that the price point is high. You know, you've got Bellicon, which is literally top of the range in my opinion, but you're looking at maybe $1,000 if you want their top of the range rebounder, as in the width of it and everything else that goes with it. And that's just not achievable. But I do always say, look on eBay, look on Facebook Marketplace, because there are some amazing deals, and you could still just buy brand new bungees and make it feel like it's brand new again. You don't necessarily have to start out with something new from the off. So if you've got any questions, you can always send me messages. Lots of people send me pictures as well, and then I can tell them the difference between something that is going to be of a good quality and something that is going to be cheap, and you can tell that by the attachments, by the frame. So yeah, I would say for that kind of sort of problem, then definitely make sure that you are getting something that's going to be comfortable for your body.
Thank you so much. That was wonderful. Very helpful. I didn't really even consider the different varying types of rebounders and how that could be make a huge impact. So
yeah, just a quick one. When we used to teach on the spring rebounders, we taught for 6 years, and I didn't know any different. That was what I started off with, so it was great. But it was only when we then switched to bungees, I realized I constantly had backache. And I was teaching a lot. I was teaching 6 days a week, minimum 2 hours a day. But I do feel that from now switching to the bungees, I've still got a sprung trampoline in my garage. And if I jump on it, I'm like, oh my goodness, it's like jumping on concrete, because I really now can feel that difference. So if anybody has rebounded and they've started to experience knee problems, hip problems, back problems, it might not just be the exercise. It could just be that the rebounder is not quite right for you.
That's really good knowledge to have. And here is all of Claire and her husband Scott's info, so you can contact her there, ask her any questions. It seems like you're very open to questions, so I appreciate
always
coming on, and thank you so much for being here.
You're welcome. Do you want me to write anything in the chat? Shall I find any of our links and I'll pop that in, or how would you like it to work?
That'd be great. Yeah, that'd be awesome.
Okay, thank you so much for having me. And I'm going to stay on. I'd really like to listen to some of the other ladies as well.
Awesome. You're welcome to stay on all day.
Okay, thank you so much for having me.
All right. Thank you, Claire. Okay. Kelly, you're next, but we're going to take a few, just probably 1 or 2 minutes just to breathe together. And let me see if Kelly is here. Yes, she is.
I'm here.
You're here. How are you?
Good. How are you all?
Good. So we're just going to breathe for a few minutes just to recenter ourselves, and also helps with our attention span as well. So we can just close our eyes, let your feet relax. And then we're going to inhale for a count of 3 through the nose. And then exhale, blow the air out for a count of 3. Inhale for 3. And exhale for 3. And then your next inhale, let's reach our arms up towards the sky. Maybe wiggle the fingers at the top, just getting the blood flowing. And then hands can come down through heart center. And we'll do that 2 more times. Inhale, lift up, stretch up, let your heart shine. Exhale, hands come down. Beautiful. 1 more time. Inhale, big breath in, lift. And then exhale, slowly coming down. Awesome. So welcome, Kelly. I'm so happy that you're here. So if you want to start by just kind of sharing your story or a little bit about you, that would be awesome.
Yeah, absolutely. Well, thanks for having me. My lighting's not great. I am a physical therapist, and I'm based in Minnesota. I have been treating oncology and lymphedema, so cancer rehab, but also lymphedema, both primary and secondary, as well as lipedema for the last 11 years now. And I was working in a hospital setting for 10 years, and then I transitioned to a private practice. I'm actually in my brand new space. That's why nothing's on the wall yet. I'm treating patients today. So that is really where my specialty is. And I have online platforms that I started probably in 2019, I believe, for education. And the reason why is here in the Twin Cities in Minnesota, where I am, we are very lucky to have a lot of practitioners and doctors who are are knowledgeable on lymphedema, lipedema, cancer rehab, all of these. And I was very naive to think that was like that everywhere else, and everyone had access to this information and support. And we were starting to get individuals who were traveling in from different parts of the country and speaking with them and learning very quickly that they didn't have access to this information. This was all new information. And again, I was naive. So realizing that just there needed to be more information out there and more resources. So I just started creating videos on YouTube and on Instagram, some information of just different side effects that people see in cancer and how we treat them in cancer rehab, lymphedema, and the components of how to do self-lymphatic drainage, because there really just wasn't a lot out there at that time. And that's where I started everything. And it's just grown, and people have been asking for more and more various resources. So the programs that you see on here, I have one specific for breast cancer that has different sections depending on what someone's looking for. If someone has tightness after surgery or cording, or tightness from radiation, breast lymphedema, arm lymphedema, and then a lower body lymphedema for someone who has swelling in the legs, and then someone who might have chronic shoulder issues, I have a program for that. So it's all stemmed off just the basis of just trying to get resources and education and information out there.
I love that. I love that you saw a need and you just kind of went crazy with it. If anyone hasn't been to Kelly's YouTube channel, you must, because she is fantastic. And I think one of the first things I noticed about watching your videos is you're so kind and caring, and that comes through with your teaching. And that's huge for, I know many of my participants here who have lymphedema, have lipedema, having someone who is teaching them, but in a kind and helpful way is huge, makes a huge impact, because you're motivating, but in a gentle and kind way, which I think is one of the things that I really saw right away through your videos and through your platform. So these are your 3 programs that you have currently. Do you want to talk a little bit about the components of these programs, if anyone might be interested in checking them out?
Yeah, absolutely. And thanks for the kind words, Babz. You're definitely the same way, so I can appreciate that. So like I said, first and foremost, I have hundreds of free videos on YouTube with a lot of this information, just different components of lymphedema, different components of how we treat various aspects of for cancer rehab, not just breast cancer, but I also have videos on head and neck cancer, breast or chest swelling. Again, pretty much anything is on there. But what I was getting a lot of questions and inquiries about is someone wanted something just more compiled and more comprehensive. And I know 10-minute videos here and there can be a lot and overwhelming to try to piece. So I decided to take it all, and I brought in a couple individuals who have had breast cancer treatment, and then same thing, who have had or who have lymphedema in their legs as my my patients, and helped me create videos and programs just to go step by step on how we treat the various pieces, or what we can do for all of the components for side effects that come along with breast cancer, whether it's the tightness, whether it's the swelling, and the strengthening, everything from there. So the breast cancer, again, there's one large program, and I will tell it to you, it's very big. It's a lot of information, and some people really like that and want to have that all there, but it can be overwhelming for some. So if someone just has tightness or just wants to get stronger, they can get just that individual smaller program, obviously at a much lower price too, and have that for themselves. Or they can get something if they have cording in their arm and they're struggling with that. There's a small program that walks through step by step on how we in therapy teach someone to release the cord themselves, the stretches they can do, strengthening they can do, and anything from there. So that's where the breast cancer rehab program is. It's 7 different programs kind of all in one or separate, really just meeting what someone might need. Again, most of this information is also on YouTube. It's just you might have to dig a little bit and piece a lot together. Healthy Shoulder Program, it's a 12-week program that I have. It's all stretching and strength program that someone can do 3 to 4 times a week. And it's step-by-step on building up strength, especially after breast cancer surgery and treatment, but also just the general population. We're prone to a lot of shoulder issues long-term. And so it's really meant to help build up strength in the rotator cuff muscles and the shoulder blade muscles to help decrease pain and things that come along with posture being off or weakness or injuries. So it's a 12-week strengthening program there. And then the lower body lymphedema, that is similar to the breast in the way that it's just comprehensive. It's broken up into all the components of complete decongestive therapy, but videos with an individual who has lymphedema on their legs, showing how to wrap, lymphatic drainage, exercises that we do. It's just going through all the components. But again, it's just much more compiled than finding things and resources online that are scattered about.
Awesome. Does anyone have any immediate questions? Oh, I see one popped in right now. How do you feel patients do with virtual self-work versus in-person? Also with accountability and completing the 12-week programs?
That's a really good question because it absolutely varies. Some people prefer that. Some people prefer to get their own pace. They, want to get up early in the morning and do their exercises versus going in or meeting someone. And I have patients, I had someone this morning who is very much about accountability and loves to come in twice a week, and we go through and build through the exercise. This a very similar program, but one-on-one. And so I think someone needs to think about for themselves, what is better? Do they like to have a program like Babz that they can follow along with and come weekly or every other week to and be within a group with, or do they like to kind of go at their own pace? And yeah, I see people succeed in both as long as it fits what they're interested in, what they need.
I completely agree. Good. Any other questions? One thing that I saw that you have too that I think my participants would be interested in is the handouts of the MLD pathways. If you want to share a little bit about that,
Yeah.
I know that.
Yeah, I do have quite a few like handouts, like printable handouts with either lymphatic drainage step by step. I have it verbally like worded out for you, or a visual like diagram to follow. I also have, if someone's just looking for a bandaging routine, that was when I got asked a lot. So it's pictures and visuals and going step by step on how to bandage a leg or bandage an arm. And then I also have exercise ones, some even from my breast cancer rehab program or lymphedema program, of step by step exercises that you can print out and do on your own. Some of them are very similar in how they come from the shoulder rehab program too. So those are all in there, again, pretty low price, and they're just hopefully easy accessible that someone can print out and have for themselves.
That's awesome. If someone was trying to find it, it's all on your website here, Cancer Rehab PT.
Yep, absolutely. Those are under the shop, and these programs are under, I believe it says programs.
Cool. All right, we have one more question. Have you worked with patients that have arm lymphedema without having lymph node removal or surgery and have had normal lymphoscintigraphy? Where to begin with treatment? Is there a specific doctor to seek out to learn more?
Sure, that's a great question. I'm trying to think. I don't know that I have had someone with arm lymphedema who's had a normal lymphoscintigraphy, but I have had individuals who have leg swelling whose lymphoscintigraphies looked normal or typical, haven't had a surgery. One thing that some of those individuals have done is we still treat them as we would anyone with lymphedema, and they respond very well. But if they're looking for more as far as doctors and support, There are various types of imaging, and lymphoscintigraphy is one of them. There also is the ICG testing, where they do the dye, the green dye and Wapchet. There are different levels of lymphatics. There are superficial lymphatics, meaning they're really close to the surface of the skin. And then there are deeper channels as well. And the lymphoscintigraphy and other testing like the ICG, they actually test different depths of the lymphatics. They don't always get everything. And so getting one test like a lymphoscintigraphy, some of our lymphedema doctors will say that doesn't give everyone the full picture. And so if someone is confused because their testing is saying one thing, but their symptoms are saying another thing, or vice versa, that could be a reason why. And it's seeking out it. Some of the surgeons do all of the testing. And so that could be something to look more into, even if someone's not planning on a surgery, but wants to learn more. They tend to have robust systems in place. Whereas I know in Twin Cities, in my area, no one has ICG. They have to go outside of our metropolitan area to get that done, but they can get lymphoscintigraphy. So it kind of depends on the area and what someone has access to, but that's something I would think of. When it comes to treatment, we still end up treating them as we would, because we want to treat their symptoms. We want to treat what they're feeling, what they're seeing, what is they're responding to. Because at the end of the day, we want to improve their symptoms, decrease pain, decrease swelling, and then again, of course, improve how they're moving around and functioning, and then quality of life as well. And so that would be the first thing, is I would still treat it and go by what someone responds to, because not everyone has access to the imaging. And I have someone whose imaging is really bad, meaning they have a lot of backup fluid showing up, but they don't visually look like it. But if we didn't know that testing, we probably wouldn't treat the same, and maybe it would have progressed. So again, it's not just one thing. We want to make sure that we're looking at all the pieces.
Thank you so much, Kelly. I really appreciate you coming on and sharing about all your programs and your YouTube channel. And everyone will have this PowerPoint and access to all your contact info. So I really appreciate you coming on.
Yeah, absolutely. Thanks for having me. This is good.
Thanks so much. Okay. Righty. How's everyone doing so far? We're doing good?
Okay.
I know all of you are probably going to watch the recording over and over again, because even just that was a great amount of information and very helpful. So let's again take another few breaths together, and we'll see if Jen is on here. Yes, she is. So we'll just start by just, again, kind of sitting up in our chair, just kind of alerting our bodies a little bit. And this time we're going to inhale, reach our arms up together. And then exhale, side bend towards the right. Inhale, reach both arms up. Exhale, side bend to the left. One more time each side, just breathing in to reach up. Exhale, side bend. Breathe in to lift. And then exhale. Nice. Then reach up one more time, stretch up, maybe roll the wrists as you come all the way down. Awesome. Welcome, Jennifer.
Thank you. I appreciate it.
How are you?
I'm doing great. Thanks. How are you?
I'm glad that you're here. So I'll have you kind of introduce yourself. I know you have a lot of different components to you, but feel free to share anything you'd like and let us know about you.
Perfect. So my name is Jennifer Panzarora, and I've been in the health and wellness industry for the past 14 years, specifically as a yoga teacher. And I found my way into working with essential oils after some injuries that I experienced, and also in my family. And I really believe that in today's modern world, with all the complications of physical ailments, mental, emotional things that we have going on, that getting back to our roots and the ancient wisdom of plants is something that can be really beneficial and really valuable, not just for those emotional benefits, but also on physical benefits. And that a lot of that wisdom has been lost over time, and that it can really help people to deal with whatever specific things that they have going on. So my original reason to get into all of this was that my mother was diagnosed with chronic tendinitis. Obviously, it's not the same as lymphedema, but she was in a ton of pain. And she had to quit her job and was not able to live the life that I know she could and wanted to live. And so I really dove into holistic healing and essential oils and figured out all of the protocols that could help and support my mom to get back to living her best life. And I know Babz and I have a similar story in that way of love for the mamas. And at the end of the day, are, you know, being able to spend time with family and enjoy life and to live pain-free is I think the goal for everyone. And when we don't have that, when we're deprived of that, it really challenges day-to-day living. And so once I found the protocol to support and help my mom, I started working with other people, my yoga students, friends, family members, and really empowering people to learn, to have the tools to learn about how to heal themselves, because I believe that we're all capable of healing ourselves. We just have to be in the right environment. We have to give ourselves, our body, the right nutrients, the right environment and support it needs to heal and to help itself. So that's how I ended up in the world of essential oils. And I've been doing that for 10 years. We've helped over 15,000 families to choose natural solutions and help them with their ailments. And I'm very passionate about what I do. And specifically for lymphedema, I have a little bit of information to give you guys in terms of what might be useful for you for some of the things that you have coming up. So I'm curious if you guys are able to, some of you I can see and some of you I can't see, but I'd love if you would just raise your hand or drop a 1 in the chat if you are already doing manual lymph drainage, if that is a practice that you are doing already. It looks like many of you are. And then type a 2 in the chat if you're like, I have no idea what that is. And Dr. Kelly can help you to learn how to do that. Of course, she was so amazing. And Babz, of course, has her amazing yoga, right? So a lot of you are fantastic. So when it comes to essential oils, right, there's basically, well, first, let me explain what an essential oil is. So an essential oil is an aromatic compound that is steam distilled or cold pressed extracted from the plant. So I like to think of, imagine yourself going through a lavender field and you take that deep breath and you smell the amazing smell of lavender and it's relaxing. I see many of you smiling, just even thinking about it, right? Or when you cut open an orange and you smell that bright citrus, delicious flavor emerging from it. That is the essential oil that you're smelling. Okay. Now, when we distill that and we put it in these little bottles that look nothing like the plant, it gives us the opportunity to benefit from those health benefits that you can get from the plant by simply having it in the bottle. And so what's fantastic is that each essential oil, if you like to think of them, how many of you have seen Marvel, the Marvel movies, right? With the little characters that are superheroes and they each have their unique specific benefit. And so today we're going to talk about the superheroes for lymph, but each plant in nature has its superpower that will either repel the pests, or attract the pollinators so that it can be prolific in life, right? And so when we bottle these little essential oils, we can use them for our own health benefits, okay? So not all essential oils are created equal. So I'll start out with that, which is why I've partnered with the specific brand doTERRA, because these are guaranteed to be pure. So essential oils are very important that you're using pure oils because that is actually going to integrate with your body's system. So essential oils are made up of the same thing that we are, so that our body understands plants, which is why it's able to actually penetrate through our cells have an oily membrane around it, and essential oils that are pure can actually penetrate through that oily membrane and help our bodies on a cellular level to repair. And for lymphedema, that is very important, right? So we want our essential oils working on a cellular level to be able to manually move that lymph so that we can drain and get rid of some of that pain and stagnation that you might be feeling. So the next thing that's important to note is that essential oils are very effective when they are safe. So because there's nothing added to it, there's nothing taken out, most essential oils on the market. So please don't go to CVS, don't go to Walmart. I know even Costco sells essential oils now and be like, oh, Babz had this lady, come, yoga teacher, come on and talk about essential oils. Like, let me just grab these from there. Please don't do that. You can have skin irritations. A lot of them are just synthetic fragrances, which may be more of like something that's in a candle that's just mixed in which case you do not want to be putting that on your skin. It could actually cause worse reactions and it's not safe. So that's why I partnered with doTERRA, which is a very scientific company. They actually test their oils 57 times before they are given to any end consumer, which is why doctors, physical therapists, any clinician will actually choose to partner with this brand because they are so effective. So with that being said, there's 3 ways that you guys can use essential oils. So the first way that you can use them is topically. So this would be with that drainage massage. So if you are already familiar with that, then you will know how to do this. But basically what you're going to do is take a carrier oil, which I like to use fractionated coconut oil, but really any carrier oil will do, whatever massage oil that you're using for your drainage. And you're going to add a few drops of essential oils with it. So specifically for lymphedema, cypress is really powerful essential oil because this helps to stimulate the motion and flow of the lymph in the body. And it also smells really amazing. Also, frankincense is really good. This is a very powerful anti-inflammatory, and it can be very helpful in general, to reduce inflammation in the body. We know that inflammation in the body causes stagnation and all sorts of problems. So my favorite blend is actually for this, which I sent Babz a while ago. It's called the Aroma Touch blend. This is specific for massage, and they might as well have invented it for lymphedema people because it is absolutely fantastic. So it has cypress, peppermint, which is good for calming and cooling. So for those of you that have pain, this can be really helpful for soothing in a very gentle way when you're massaging the lymph to help calm some of that pain. It also has marjoram, basil, grapefruit, and lavender, which is very calming. So this combination is fantastic. I love this oil. It is great. The other one is Balance. This one has a blend of spruce, frankincense, blue tansy, blue chamomile, and osmanthus. And this one can also be used topically to massage in and help move that lymph. The other essential oils that are really important for lymph drainage are citrus oils. So citrus oils are really powerful for detox. So this can be used to also apply topically, and you can layer these in one at a time. I'm going to read you a testimonial in a moment. You can layer it on your skin and move with the massage oil as you're doing your lymphatic drainage to help the liver process everything and help get rid of that stagnation, right? And so the thing with essential oils is that you really want to find the combination that works best for you. And not everybody is the same, as we've heard many times already on this call, is that everybody kind of likes to have their own spin and their own mix of what they find that works the best. So I took the research of the lymphedema community to provide you guys with some of the recommendations that they say. So the first way to use them, as I mentioned, is topically, right? So you're going to take them and you're going to massage them in when you're doing your lymphatic drainage. The second way that you can use them is to actually ingest them. So again, reminder that not all oils are meant to be ingested. There are only a few that you can, and they have to be the quality level that you can take them. So this one is a blend of, it's called MetaPower. It's a blend of citrus. And this is really good for metabolic support. So this can be topically massaged on as well because it has all of the citrus oils that are good for detox, and the cinnamon, which amplifies the effects of the drainage, and the other oils. And then it also has the ability to be ingested, right? So this one is grapefruit, lemon, peppermint, ginger, and cinnamon, which we also know have anti-inflammatory properties. So this one can be massaged in, as well as taken 1 to 3 drops in water throughout the day. So important to note that citrus oils are very delicious, number one. So another thing that's really important for our lymph, right, is that we want to be hydrated. And when our body is hydrated, that lymph is going to move easier. So adding 1 to 3 drops in a stainless steel or glass water bottle is going to help you to drink more because it tastes delicious. And as you drink more water, then that lymph is going to be able to flow better. And because you're using citrus and because it's very concentrated, it's very different than just adding in, like, let's say you just put squeeze a lemon in your water. This is 7 times more powerful. So it's going to really actually work because it's giving your body what it needs to be able to help itself detox. So it's not the same as if you were to just, grind up some ginger and orange and those types of things and put it in there. It's much, much, much more powerful. So the third way that you can use essential oils is going to be to diffuse. So putting them in the diffuser. If you don't have a diffuser yet, I highly recommend that you get one. And I put together a little bundle of these oils for anyone who wants to get them, that you actually get a free diffuser, which is amazing. So I know that through this process, right, sometimes it can be stressful. It can be frustrating. It can be very challenging to go through a health episode where maybe you aren't feeling your best. Maybe you are in pain. Maybe you're not having a great day. And that's where diffusing essential oils can really come in, right? So when you're doing your yoga classes with Babz, you can put on your diffuser and it will instantly shift your mood because our processing system, our brain, the way that we process emotions is also the part of our brain that processes smell. So this is your olfactory system, right? So as you smell, you're going to start to shift your emotional state. And so just like when we're thinking of that lavender field, right? How you feel more relaxed. Actually putting that in your diffuser is going to be very helpful for your mood. So as you're putting it on, as you're smelling it and having it in your diffuser while you're working or while you're watching TV or you're in a stressful situation, maybe you're nervous about going to the doctor, right? These are all beautiful ways that you can create positivity in your day. And then the last way is to add these essential oils in a detox lymph bath. So you can add lemongrass, lavender, and this MetaPower blend with the lemon, the grapefruit, which is going to help, and peppermint and cinnamon, which is going to help support the liver. You can add that into 1 cup of Epsom salts in your bath. And this is going to help you soak. And then you're going to get the oils in that way. So I just wanted to read this little testimonial really quickly to you because I think it's really cool because this is your community. So one woman said, I wanted to share our success to help other people who suffer from lymphedema. This is from our community. I took the combo, lots of advice plus some. I took a bath with 2 drops each of cypress and lemongrass, and I immediately did lymphatic drainage massage using a carrier oil, layering them 1 by 1, 3 drops lemongrass, and then started to massage, clearing at the shoulder and stimulating the lymph at the belly button. Then 3 drops cypress, added through the chest and the fluid through the upper arm, and then 3 drops of this metabolic blend, massaging through the forearms, hands, and fingers where there was hardening, and then adding the last blend, which is this aroma touch. And the next morning, the results were incredible. There was a little bit of loose skin on the hand, but I was able to wear the compression garment that had become too swollen from the previous year because the arm had reduced so much swelling. And I felt better all day. Of course, anyone with lymphedema knows that we have to keep this up daily, otherwise the swelling will come back, but it's about effectively managing the swelling to avoid all kinds of problems. I'm so excited and I hope this helps somebody else. Last one is, I had swelling in my lower legs. On the right side was worse than the left, and I found that exercising helped. I was really resistant to wearing support, blah, blah, blah. I decided that to ask a friend who knows about essential oils, and I used the Aroma Touch blend, the frankincense. And I tried these for 2 weeks with not a ton of help. The swelling was getting worse, where I had swollen ankles all of the time. I read that lavender helps with swelling or edema, so I started using that at the same time that I was using a citrus blend, lemon, lime, wild orange. And today I showed the friend the results, and he told me, I can't believe that you have ankles again. So if you're having trouble with swelling in your ankles, try some citrus oils combined with lavender.
Amazing. Awesome. Thank you so much, Jennifer. That is really good, tangible facts and helpful tools that this community can use. We probably have room for one question, and I see it in the chat. It says, how many drops of oil to 1 cup of Epsom salt for the bath?
Good question. So for these oils, I have actually all of these written out for you guys. So if you want to, you can just drop your email in the chat here, and then I can send you the detox bath recipe. I can send you the diffuser recipes, and I can send you the specific oils to use with the topically with the massage blend. And then you can get the link with 25% off. So just drop your email in the chat, and then I can send that directly to you guys in a little email where you have all the info you need. As well as I always give a complimentary wellness consult from anyone who decides that they want to do this or to incorporate it into your routine. And I can, sit down with you and make sure you know what you're doing and troubleshoot some of the trials and tribulations that come from just learning something for the first time. So
thank you so much. That's awesome. Feel free to send it to me too, and I'll send it out to those people who aren't here live today, because there's a lot of people watching the recording. So I'll of course send that out. But thank you so much for being here and for sharing all of this and catering it to our community. So I appreciate you very much, and thank you.
yeah, thank you. Appreciate you.
Okay, so Amy is next, and I saw you earlier on here, Amy. Let me find you. There you are.
Hey,
Hi, how are you?
I'm good. Thank you for inviting me to this. These are always fun.
Yeah, I'm so happy that you're here. We'll take just a minute together just to recenter. And Matt, who's on this slide as well, we love Matt, but he was unable to join today. But I thought I'd include him too because of your book together. But I'm so excited to dive into all of your offerings. But let's just take a moment to settle together and to kind of digest all of that information that Jennifer shared with us as well. So we'll just close our eyes and relax the shoulders. And then we'll inhale for a count of 3. This time, exhale for a count of 5. Inhale for 3. Exhale for 5. And then we'll just take one circle in one direction. So coming forward on the inhale, exhale back and around. And then we'll go the other direction. And you can continue to do this in your seat for everyone listening, just to loosen up the center lymphatics while Amy shares a little bit about herself. And she has quite the inspiring story. So I'm happy that you're here.
Thanks for having me. That felt good, actually. So I'm Amy Rivera, and for those of you who don't know who I am, I was born with primary lymphedema. However, I was misdiagnosed for over 32 years. So if you would Google my name, Amy Rivera, and type in leg, you will see that my right leg became 200% larger than my left leg because I didn't know what to do. So once I officially received my diagnosis in 2013, the fire was lit in me. Like so many other people on here, I was told it was this or it was that, or it wasn't lymphedema because, and these are the words that the physicians have used, I wasn't fat enough, or I wasn't old enough, or I didn't have cancer. So I was actually born with the entire right side of my body becoming twice the size of my left side. And after a few days, the swelling went down except for in my right leg. Come to find out, I have Milroy's disease. I also have a central lymphatic dysfunction, and we're ruling out some other health concerns that kind of go with primary lymphedema. It's the gift that keeps on giving. So it's quite a journey, but most importantly, during those 32 years of my life, I felt completely alone. I didn't look like anyone else in my family, my peers. Nobody could tell me what was going on. My poor parents took me to one physician after another, and the doors were just slammed in their face. And they're like, we don't know what this is. So, they carried that guilt with them for many, many years. And as I began to learn more and more about my body and what lymphedema was, I understood more about what the lymphatic system was. So I was a nurse, and I did not learn what the lymphatic system did. So when I hear physicians say, I really don't know a whole lot about this, I can understand, because I didn't know a whole lot other than it fights infections and that's about it. I had no idea about all the amazing other things that the lymphatic system did. So like so many other guests on here, I was led to find my own journey, my own tools, and I really did self-diagnose myself in the beginning because nobody else would listen. So fast forward to where I am today, I didn't want anyone else to feel as alone as I did. And I didn't want the medical field to feel as attacked as I seen it in the community. And so I understood both sides of the spectrum here. I understood the lack of understanding, the lack of education, the lack of resources, but I also saw the lack of community just within ourselves. And like I said, I felt alone in my hometown. I felt alone growing up. I felt alone in nursing school. I felt alone, period. So I wanted to bridge that gap. And that's when I reached out to Matt and said, let's connect the ponds and let's see what we can do. And so the Lymphedema United, You Are Not Alone, birthed from that idea. We wanted other individuals to share their stories. I've shared my story so many times everywhere, and people think it's so easy to do, and they never wanted to do that, and they didn't know how to do that. And so I wanted to guide them through that process, and I wanted them to know just how powerful their voice is within the comfort of their own home, within the comfort of their community, and how to connect with individuals all over the world because they're not alone. And so that's where Matt and I, again, created the Lymphedema United. We not only wanted to share voices across the world, but we wanted to also raise money for nonprofits such as my own Ninjas Fighting Lymphedema Foundation and other nonprofits that focus on lymphedema and lipedema awareness. And that's what we did. We've taken the funds, a portion of the funds, and we've supported other nonprofits, and we've created a global awareness, which is something that's been very near and dear to my heart since I was diagnosed in 2013. So you can find the book on lymphedemaunited.com. You can find it on Amazon. It is on winourfight.org as well, but that's just a portion of what I do.
Awesome. And Amy and Matt were kind enough to include my mom and I in this book too, which is awesome. Amy, I'd love for you to share about your blueprint, the lymphedema blueprint program that you have, because I think this is a masterpiece in itself. So if you want to share a little bit about that.
Absolutely. And you just reminded me. So my daughter has lipedema, and funny story, she got it from her dad's side of the family. So she has lipedema and she started to show signs of lymphedema. And she's also written a chapter in this book as well about sharing her struggle with lipedema and finding her why, which she connected with animals. We got her first service dog to help her navigate through high school with these. She had a lot of self-identity issues that I can relate to as when I had lymphedema. And so we wanted to really help her through that. And then she went on to create a business with therapy dogs. And so she has written a chapter in this as well. But the lymphedema blueprint course. So back to when I was misdiagnosed and trying to find the right information, because there's a lot of wrong information out there. By the way, I do refer a lot of people to Kelly and her resources, Babz, to you know, your resources. Like you said in the beginning, to people that I trust and I know who really know what they're doing. I didn't have that growing up. I didn't have that as a young adult. So I wanted to create the Lymphedema Blueprint course, which has over 67 modules, over 47 pages of literature. We have experts like Babz and Dr. Granzo, and we have an attorney speaking about insurance coverage. We have Leah with Lymph Club talking about just the lymphatic system, Lymph Love Club, I should say. And we have so many other amazing experts and nutritionists. You know, I talk about I'm the expert patient. I live with lymphedema, but I'm not the expert on all these other areas. And so I wanted to bring the experts to the table and build a platform for everyone to take their time to learn about their own lymphedema journey. We're all at a different part of our journey. And so I wanted to create a safe place in the comfort of your own home to learn at your pace, because some of these modules are probably a little easier than others to get through emotionally. We start with mindset. In order for us to tackle our lymphedema symptoms, we must understand where it starts, and it starts in the mind, and then we connect with our heart, and then we're able to connect with our bodies. And so the course goes just like that. And we have a private community. We also have a private Facebook group. I go live. We have all these amazing benefits for it. And I didn't want to count anybody out. So I've thought of everything I possibly could, and we're still continuing to build the course. And as information continues to grow, so will the course with many more experts. These are people who have helped me personally on my journey. And if I was able to reduce my right leg from 200% down to 2 to 3%, and I'm not saying this is easy, I'm not saying this is short, this is a journey, but if I'm able to do that with these individuals and what I've learned, so much, you can get so much out of it. And so that's why I wanted to create that course.
I really appreciate you sharing about it. And I didn't even know that the mindset was part of it. So that makes me love it even more, because I love the analogy of, it starts in the mind and then connect to your heart and then to your limb and to your body. So
yeah, because it's all connected. It's all connected. And and when I tried to help myself in the beginning, I couldn't, because I couldn't get past this. And so people see me and they're like, you're so happy all the time. Listen, social media, they call reels for a reason, highlight reels, but I get very raw in the course. I get very raw in the community. There are days that I struggle, and I want to show that to people, because it's even though I've been able to reduce my leg, I still have the symptoms. I still have other issues, and I want to be very transparent with individuals, because those emotions are real, and it's important to feel them and go through them and then learn from them and heal from them. And so it all starts in the mind.
Amazing. I saw someone in the comments say, beautiful, Amy. So I agree with that comment. And thank you so much for sharing your book that you mapped together, and then also your blueprint program. That all that information will be sent to my participants, and keep doing what you're doing, because it's helping us a lot. So
thank you. Thank you for having me on.
Awesome.
Thank you.
Thank you.
Okay, let's see. Perrin, are you on here? Let's see. Yes.
Yeah, I am. Hi.
How are you?
I'm good. I'm so happy to be here.
Oh, it's been a good day so far, everyone, huh? So before we begin, we're going to take just a minute or so just to ground ourselves and get ready to dive in to your session. So we'll just close our eyes, everyone, and we'll take a breath in through the nose for a count of 3. Exhale for a slow count of 6. Breathe in for 3. Exhale for 6. And then your next breath in, we're going to reach our arms up, stretch the arms up. And then as you exhale, we're just going to take a twist towards the right. Breathe in here. Exhale, let it out. Inhale, lift the arms up, stretch up. Exhale, twist to the other side. Breathe in. Exhale, open mouth, exhale. And then last time, inhale, reach the arms up, stretch up. And then hands come down to heart center and we'll begin. Awesome. Really good segue right into your session. So tell us a little bit about yourself and your inspiration and why you do what you do.
Well, thank you, Babz. I'd love to. And also, thank you for collectively bringing all of us together, because I think when you know you're not alone, there are resources and there's always exciting things you can learn about your body. That's when you have hope. And I think support are part of the reason you can breathe, the part of the reason that you can keep going. So what I would add to that little segment, that breathing segment, which is so incredibly powerful, how can just a few breaths completely shift your whole mindset? I would add, where is your tongue? So with that, I am Perrin White. I'm the founder and owner of Breathe Well, Be Well. I am a speech language pathologist, a certified oral facial myologist, a registered yoga teacher, and a breath coach. But what I really care about is, how are you breathing? And what's been extremely powerful and profound in my, I would say, like, evolution, because you don't get to where you are just overnight. It takes so many pitfalls and wrong turns, and you think mistakes, but really are life lessons to understand that your breath is a combination of your anatomy, your physiology, and your emotion. And how this links with lymph and lymph health is just whole body health. So the brain, the body, the breath, they are all interconnected, and we can attach and we can help support each of them in different ways. So my speech language pathology background really was the segue into myofunctional therapy. So essentially with myo, that is a niche, a segment within speech. It can also be in registered dental hygienists in the dentistry region, but essentially I get really nerdy about the muscles of your tongue, your jaw, your lips, and I want to make sure they're doing their jobs for speaking, for swallowing, for breathing. And it wasn't until I got my yoga teacher certification in 2020 and then several breath coaching certifications that I was like, oh my gosh, we're saying similar things, but in different ways. Also, there's a small dog in my lap. So if you see a little head pop up, this is Vanna White. So essentially, how can we teach people how to breathe about their body so that we can reduce pain, reduce their TMJD, actually help them get their tongue in the right place so they actually can take a full functional breath and get all the components working. That includes the way that you're talking to yourself. So as far as tongue rest posture and tongue, all right, I think we can see this okay. The tip of your tongue should be right behind your two front teeth. It's also where you say na, 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 na. So we want the tip of the tongue up here. Now, the tongue is not just one muscle, it's actually 8 muscles. So think about it as the front of the tongue needs to be up. This is our anchor. This is our home base. Now we want to start lifting the middle and specifically the back part of the tongue, because that's what's going to allow airway space behind the tongue, which is the throat. So we want to be predominantly nasal breathing, and to be able to do that, our mouth needs to be closed and be able to have a complete intraoral suction. Our complete tongue needs to be sealed up to the palate. That allows space behind the tongue to open so that when we breathe in through our nose, that negative pressure pulls it in and goes behind the throat and into the lungs, filling the lungs up, diaphragm contracting. And then when we exhale, the diaphragm relaxes, the lungs compress, they're pushing all that air out, the ribs knit back together, and our tongue is not getting in the way. Sorry about the, okay, there, the blurring. I don't want you to see my background, but I want you to see this. I want your air to have a clear path. And this is when we're awake. So think about when you go to sleep on your back, everything is relaxed and collapses. And so I have a lot of clients with upper airway resistance, with snoring, with teeth grinding. And essentially, I'm looking at it from an airway issue as well as your breathing behavior issue. So with clients, I'm addressing tongue rest posture, nasal breathing. I get them to an ENT if they need it. I also train them how to unblock their nose. What are some nasal hygiene routine things that we can do? And then the body work, the yoga, how do we actually get into the diaphragmatic region and thinking about all these different components, all these different pressure capsules. And we have all these floors, the tongue being a big one, the diaphragm being one, the floor of our pelvic floor. And then you could even go into like palms and feet, depending on how deep down the rabbit hole you want to go. But essentially, I care about this because this is what I needed to keep myself okay. And my high school superlative was most likely to fall asleep during graduation. Now, I got plenty of quantity sleep, but the quality sleep was never there. And it took me a really long time. Actually, it wasn't until I was an adult, 34, that I realized I wasn't breathing properly. So I think the part that's really interesting is if you cannot breathe well during the day, it's going to be really challenging to breathe well at night. And if you don't know what adequate functional breathing looks like day and night, it's going to be really hard to help. You don't know what you don't know. So that's why you have to be curious. And that goes into, I'd say, the 3 rules of the body that I work with. 1, you are not broken. So you're listening, you're talking. You might not be breathing well, but you're breathing. So you're not broken. 2, your body is talking to you all the time. And those are symptoms. So your symptoms might be, I just clear my throat a lot, or my mouth feels really dry, or my jaw is just killing me, or I'm clenching my teeth, or I get migraines, or I get ear infections all the time, or my sheets are a mess, like I'm moving all throughout the sleep, or I get migraine. I mean, these are all the things that the body is doing to actively tell us in communication. And then 3, you get to learn the language of your body. So that's the body, the brain, the breath connection. And if you don't know what to do, having someone like myself, a myofunctional therapist that can help you retrain the muscles of your jaw, your lips, your tongue, having someone that can help you meditate or actually learn specific breathing practices is really helpful. And then just teaching you how to take care of your body. And what I also find very powerful is when I work with one client, I really am telling them you are changing the language of breathing for your whole family. So what's beautiful about breathing is there's regulation, co-regulation, co-dysregulation. So I like to think my dog's so calm because I am breathing and I'm calm and we both make each other happy. You can tell when someone's breathing is off. You get like that spidey sense. You're like, what is up? Now, you don't have to also be dysregulated. You can be aware, you can notice, you can rest your tongue up to your palate, you can unclench your jaw, you can breathe through your nose, let your belly rise, your ribs expand. You can breathe out of your nose, letting your belly fall, your ribs knit back together. And I was thinking, what would be one really great exercise to go over? Because I never want anyone to leave frustrated that they can't do something about it, because you can always do something. And baby little shifts are my favorite. So I always say I'm blending science and spirit to help you breathe and be. So with that, first, we're just going to work on the tongue a little bit. I mean, I'm talking simple. Just click your tongue. If you want to get real, let's see, if you want to go like up a level, can you click your tongue without moving your jaw? And I want it clear, I want it sharp, I want it fast. I always say, like, all right, we're going to click your tongue every time you buckle your seatbelt. Click your tongue every time you hear your favorite song. Actually, that Beyonce Texas Hold'em was a really great tempo. Make it fun. If you're going to laugh, you are absolutely going to grab hold of these practices so much faster. So click your tongue, then slowly start to see if you can freeze your tongue, hold your tongue up into your palate. And not just the front, but slowly the middle and the back, until ultimately you have a full lingual palatal suction. It's also called a tongue cave. So that's where we want our tongue to be. Now, it's not going to work if your nose is blocked. So this is an oxygen advantage exercise called nasal unblocking. If you haven't looked into oxygen, yeah, Leah said tongue cave. Yes, tongue cave. But oh, side note, I always say if your face looks like you're constipated, we're working way too many muscles. I don't want to see this. I don't want to see this. Whew. Shifts, small little baby shifts, baby steps. So our tongue is up. We're not walking around like this. So just slowly close your lips. Breathe in out your nose. For nasal unblocking, which I usually do 3 to 5 rounds, but we'll just do 2 for this for time. You're going to breathe in through the nose, and then you breathe out of the nose. And at the bottom of your exhale, you're going to pinch hold. You're going to nod your head while you're holding your breath, lips closed. And essentially, we're building our nasal nitric oxide. We're also slowing down the breath. We're reminding our body we're safe. And when you reach that max, that ceiling of like, whoa, I cannot go any longer, you breathe in through the nose and out of the nose. And then you take a few recovery breaths, and then we do it again. So as a recap, I'm going to do it with you. We breathe in, we breathe out, pinch, hold, nod. Oh, also the nodding is helping to engage the vagus nerve. Oh, sweet baby Vegas. Actually, sweet mama, big mama Vegas. She's a big one. And then you let go once you've reached your max, breathing in and out of the nose. So in, out. And actually, I'm going to do that one more time. Breathing in, breathing out. I love this exercise because it's accessible to everyone and it's you versus you. It doesn't matter what I got. It doesn't matter what Babz got. It doesn't matter what Leah or Lisa Borden, all these amazing people I'm fangirling over. It doesn't matter what they got. It matters with what you need in this moment. We hold our nose to build up our nasal nitric oxide so that when we let go and breathe in through our nose, it then goes straight to the lungs, acting as a vasodilator. We nod our head, or you can sway to help engage the vagus nerve, just reminded, hey, wake up, pep up. We need you. We're recruiting you. And then we are slowing down, counting if you want to, because counting engages the amygdala. The amygdala is where anxieties and worries live, or for counting, and it's really hard to do both. And then we always come back to the nose, one for the nasal nitric oxide, but 2 to retrain the body that we can breathe nasally. So in a nutshell, if you have speech, swallowing, or breathing issues, I can help you. I work virtually and in person. I'm in Greenville, South Carolina. But I have a course coming out, Functional Breathwork Basics, that goes over nose, tongue, diaphragm. That, that is what I'm really excited about because I can't be in person or one-on-one for everyone. So that's going to be accessible, launching in August, late August. So you can sign up for my newsletter through my website to get insight or follow me on Instagram. I also do free 15-minute discovery calls that you can book if you're breath curious about breathing, about tongue ties. And just know that you're not alone. You've got help and support, and it's so nice to connect with you all here. Thanks so much.
Awesome. Thank you so much for that. That gives us a good tool to use the rest of the day. So this is perfect.
I know, you just maybe don't do that while you're driving. I don't want you to
Yeah, that's
make sure you need it.
Keep your eyes open. Keep the holes open.
Thank you, Babz.
Thank you so much for joining. We really appreciate it. And we see a lot of love in the chat for you as well. So all your information will be shared with the community. And that's great. You have an upcoming program in August. So we'll keep an eye out for that and send that my way. And I will, of course, promote.
Yeah. Thank you. Appreciate it.
Awesome. I see a couple people in the chat saying, wow, thank you. So appreciate that a lot. Okay, let's see. Leah, I think I saw you come in here.
It's me, yeah.
Hi.
Hi.
How are you?
I'm great. Thanks so much for having me. I love this little lymph powwow that we're doing.
I know, me too. It's really, I said at the beginning, I said I handpicked all these specific people and everyone for a specific reason. And before everyone has their own little slot, we do some breathing together. So we'll do that and then I'll let you take it away. So let's just place our feet onto the earth and sit up nice and tall. And we're gonna do some seated cat and cow together with the breathing. So we're gonna inhale as you pull your chin and your chest forward, open up through the heart space. And then as you exhale, slowly curl in and tuck the pelvis. Let's do it 2 more times together. Inhale as you come forward. Check in that tongue position. Exhale, coming through. 1 more time. Just getting a little bit of movement, a little lymph flow, a little blood flow. And then we'll reach our arms up towards the sky, stretch the arms, wiggle the fingers, and then draw our hands down to heart center. Awesome. Good. Okay, Leah, if you want to share a little bit about you, your inspiration of why you do what you do, and yeah, anything you'd like to share.
Sure. Thanks for that little move too. I feel less nervous. I don't know why, but every time I speak, I always get sort of like, oh, here we go. So, well, firstly, thank you so much for having me. And there's so many familiar names and faces, and I just am so grateful for the lymphatic community, and I'm so proud to be a part of it. So my name is Leah. I am a licensed massage therapist, and I'm also a lymphedema therapist. And how I got started is, man, how did I get started? My mom, she got breast cancer when I was a teenager. And I think that was my first introduction to the lymphatic system. I saw that she was dry brushing her skin, and I was really afraid of what was going to happen. But everything turned out all right. She's doing well. And I felt like the way that she cared for her body and rehabilitated was a big part of her healing. So I've just always had a good appreciation for the body's natural ability to heal. I started doing massage when I was about 6, just sort of intuitively massaging my family members' shoulders and feet. And, I think my mom would give me like a penny a minute. So I started my first business when I was 6, a penny a minute doing massage. Cost a little bit more these days, but I finally found my path, and I went to massage school in 2016, and man, it just changed my life. It really put me on the path to connect with my own body and to help others connect with their body. It's been really special. So I did like traditional massage for the first couple years, and I noticed that there were some people that I just wasn't able to help. I wasn't sure what was going on with their body. It was just like I was working on the muscles, working on the joints, mobilizing, stretching, pinning, putting a lot of deep pressure in there, just beating people up. And then I found this guy, really out there guy. His name is Dr. Perry Nicholson. And the way that he spoke about this system was such, man, I don't know, like just vigor and passion. I knew there was something special about it. Now I'm going to get all emotional. I'm sorry. But it's just like, it was really awesome. Once I found it, the system, I couldn't unsee it. And I got certified, and I started using it on people, and it was just like changing their lives. And that was really incredible. And it made what I did so much more. I just felt so much deeper, even though it was this really light, gentle touch. So I don't know. Then I got into the fact that not all lymphatic systems are the same. And I realized, like, oh man, there's some people that their lymphatic systems work a little bit differently. We have to approach them a little bit differently. And so I got certified in lymphedema and started seeing a little bit more complex. So I do specialize in working with chronic illness and people that are dealing with a lot of toxicity, a lot of issues in their body and health stuff, but it all kind of revolves around the lymphatic system. And the lymphatic system is this like juicy center where all the other systems revolve around it. And while I enjoy working one-on-one with people and it's so powerful, I just felt like once I started sharing online, just like these little tips and tricks, I was realizing like, oh man, like people need this so bad. And so I started this online lymph loving club and it's turned out to be really awesome. And yeah, so I'm just trying to bring people together online to move their lymphatic system, to learn about their lymphatic system, to reach people that don't have the resources to access therapists like us, like me and Babz and Kelly. And the work that we do here it's incredible, but it's also super important that we're sharing what we know with the world because the world really needs it. I do have an in-person clinic in Austin, Texas. If anybody is in Austin or know anybody in Austin, send them our way. That entity is called Align Massage and Lymphatics, and we're located in the medical district in Central Austin. It's a very small team right now, but we see a lot of lymphedema, lipedema, and chronic illness. And online, I love to teach in a way that I love to learn. I want it to be interesting. I want it to be fun. I want it to be exciting because it is so exciting. The lymphatic system is just, it's incredible. I think it's the future of medicine. I think that it's going to change the world. It's going to change the way that we show up for ourselves in this Western way of thinking. And I'm really excited about it. So the Lymph Love Club it's a private online community with like a monthly membership, and we meet once a week to move our lymph together. We recently started a book club, so we're currently reading The Neuroscience of Self-Love. It just so happens to be in a container of lymph, but it is so much more about body autonomy and understanding how everything works together. The lymph is the tip of the iceberg, right? So I do some tutorials in there and some written deep dives, but the whole point is to get to know the people that are coming in so that I can help them in a way that's not like 2 sentences in the comment section of social media. It's just not enough. People have so many questions and I don't have all the answers, but I can help a lot of these questions go away for people with education. And so I think that that's pretty important and pretty cool. I think it's probably the coolest thing that I've done so far in regards to Lymph Love Club, because I do have some online courses as well. But kind of going back to that part where people have questions, once those questions are answered, they're going to have more questions, and people run into roadblocks with course content sometimes because maybe they try something and it doesn't work, or maybe they need to modify it. So I've just found with the online community that it's a way of like continuing that growth and continuing like helping people through those roadblocks, and so that they can tackle their own symptoms and become their own lymphatic experts, with a little bit of help and guidance. And it's been really rewarding to get to know people. And we've just recently started it not too long ago. And I've got a lady in there that's already saying, man, like my acupuncturist told me today that she's noticing that my inflammation has just gone way down, and asked me what I was doing differently. And that made me really happy because it was like, man, these are like almost like virtual clients, sort of a way of mentoring and guiding and supporting people as they try these things. Because a lot of online, we see these great videos. There's so much amazing content out there for people to choose from, and there's so much information. But I think a little bit of support to apply those things to our bodies is really helpful. That way people don't get lost along the way, or they don't get frustrated and give up, or feel overwhelmed, or there's like a failure to launch. There's all kinds of reasons why we can't move forward. Sometimes it's like identifying those roadblocks and just helping people feel confident in the way that they're showing up, because we've got a lot of different tools that we can use, but we really want to understand why what we're doing is important and how it works and how these tools influence our body and physiology, and just how to show up with lymph love. I go back and forth about what is the definition of lymph love. And I think that it's just like this all-encompassing self-acceptance and grace and consistency and excitement, you know, just caring enough to keep moving forward. And those are the things that kind of get us through the hard times, because we have our ups and downs with health. So we've all got our struggles. And I think, man, Babz and I did a book club a while back, and one of the quotes that really stuck out from this book was that empathy is a necessary ingredient of like a shared experience. Or I think I just messed that up. A shared experience is a necessary ingredient of empathy. And I feel like I go back to that sometimes, that quote, that page, that line, because it's so true. We're all in this together. And I think that when we heal ourselves and we work on ourselves, it just radiates out. Maybe that's lymph love. It's like the ripple in the pond, you know?
I think that's perfect, Leah. I think that's exactly what you're doing, is that ripple in the pond. And I know if I had a chronic condition or lymphedema, I'd want you in my corner, because you put content out, you share things that you truly believe in, and you're not just putting things out there just to put things out there. Like, you really take the time to make it digestible for humans and for people going through things. So I really appreciate your platform on social media, but also that this community that you're forming, that is awesome, that you're actually able to now have these people and this support that you can continually give out. And I've seen, and you've told me all the different components that you have in your program, and it's not just lymphatics. So you talk about hormones, you talk about like detox, and you talk about all these different components that kind of like encompasses the human body. And I think that's also cool. What you do is that you bring in everything. And if you're not an expert in something, you research, you look it up, you become like really knowledgeable about that topic. So I appreciate what you're doing, because I think it takes a lot of work, and I know that, but it really is paying off for our community. So we appreciate you. And I see the comments, everyone's sending you a lot of love. So thanks.
Oh, thank you. Thanks, Babz. You're such an inspiration.
Thanks for being here. Any questions? We could take maybe one question for Leah. All of her information will be sent out as well. And if you're not already following her, make sure to follow her. I remember the first time I found your page, I messaged you and I was like, your content is as educational as it is funny. Like, Leah has a way of bringing in humor into her content too, which is key for someone like me or someone similar to us who's trying to learn something. If you can have that humor component or that kind of artistic and like inspiring component, that makes that information just able to come in a lot easier. So cool. All righty, thanks so much, Leah. Okay, I see another comment said humor with education, good combo. Absolutely. Okay, let's see. Now, Lisa, I see that you're on here. Let me find you. Oh, there you are. You can unmute yourself. Okay, and I'm gonna spotlight you. All right, so we'll just take another minute just to settle in, and then we'll begin. So let's again just close our eyes, let the shoulders relax. And then we're gonna recite a mantra together. So as you inhale in your mind, say, I try my best. Exhale, and I release the rest. Inhale, I try my best. Exhale, and I release the rest. And then inhale, reach your arms up. And then we're going to imagine that there's a rope coming down from the ceiling. And you're going to grab one hand and then the other, stretching through the side body, just opening up the heart, feeling it through. Maybe add a little dance move, just shake it in your chair a little bit. Awesome. And then we can just let it settle, let the dust settle and relax. And welcome, Lisa. I'm so happy that you're here.
Thank you for having me. I said it's it's been amazing to listen to everybody be so succinct. And as Leah said, she gets nervous when she speaks. I don't get nervous when I speak, except for I don't think I've ever spoken for 15 minutes before. I'm very long-winded. So I'll try and summarize what I do best, because I don't work directly in the lymph space. So it's maybe different than what others have spoken about today. So my name is Lisa. I have a degree in French. That's my original professional training. That has nothing to do with what I do. I have been a business development and marketing consultant since 1994. That's when I started my business. I have 3 kids who are 23, 21, and shortly to be 17. And really, I don't really like titles. I could tell you that I've written 8 books, that I've consulted for thousands of clients, that I work with conscious brands and businesses to help them reach their audience. So everyone who's spoken here today could potentially be a client, as well as, an organic chocolate cake company or things that you see behind me, like reusable water bottles before anybody did that, and help bringing things and concepts and people to market and make them popular, all kindly. But it was really my kids that threw me into what wellness really means. We touch on this a lot. When my daughter, who was my second child, was born in 2002, she was, I'm just going to say, not well. And we spent a lot of time in the hospital. My father is a physician. My cousin is an orthopedic oncologist, well known in this world. I am surrounded by lots of people in the medical world, and I relied on all of them to help me navigate this system. I'm in Toronto, Canada, so things are very different here than in the US for healthcare. And what I felt was we were getting great care, but my daughter was sent home out of the hospital at 3 months, and I was told that I shouldn't breastfeed, that she was going to have breathing oh, good to meet you, LymphWell Collective, fellow Canadian. But she was told she wasn't, I was told, because she was so small, that she wasn't going to be able to breathe, that she wasn't going to be able to be in nature or play outside. And as a mother, for any of you who are parents, that's not what's okay to hear. And so I guess you either crumble or you fight. And I fought. So I got into specialist after specialist. And I finally got in because of all my connections in Canada. It took me still 6 months. I think her waiting list was 2 years. And I realized this is awful. I'm so fortunate to have these connections, but what about people who don't have these connections? And I went into the specialist, and I'm holding my baby, and I'm so excited to get some answers and to feel heard and supported. And she looked at me and she gave me a cortisone cream and Benadryl. And she said, not only to give this to my baby, but also that I should be taking these things and an antidepressant and a sleeping pill, because otherwise I was going to lose my business and my marriage, and my relationships would all be, because I wasn't sleeping because my daughter was crying all the time and I was worried. So I went home, and it wasn't Google at the time. I guess it was, message boards, without dating me that much. And I found this group of moms, like a group of you guys who've all spoken today, where it's like, we got these micro communities and these communities, and we need each other. Like Leah, you said too, it's like together, right? Better together. I repeat that like over and over again in my work. And these women just told me about cleaning chemicals and how you have to get rid of the cleaning chemicals, and it can really help. And after years or almost 2 years of going through this with my daughter with no solutions, I removed the cleaning chemicals from my house. I put them into my laundry room because I didn't actually believe I could keep my house clean. My kids, my neuroses. Breathing changed. Everything changed within around 10 days. It was maybe 2 weeks. I went to my laundry room to get rid of the cleaning chemicals, and my laundry room stunk. So for any of you who have smoked before or used cleaning chemicals or are sensitive, it's amazing when you remove something that never smelled to you before when it was in your presence, and you remove it, and then all of a sudden you cannot breathe. I put it out by my curb, and I got a ticket for hazardous waste at the garbage. I was told I had to call the toxics taxi, and I thought, holy shit, this stuff is sold at a supermarket. This is crazy. And that was really my entrance into true non-bullshit wellness, of figuring out how we can show up for ourselves and each other for solutions. And fast forwarding through all of this is, I'm not really big into moderation. So when I find something exciting, it's like a rabbit hole for me. That's my hobby. I'm so excited about it. So I did inventory on my personal care, on my food, on all of these things. And I always call my daughter my hero, because that was that catalyzing moment, that like big aha moment that shifted things. And then I came back to my office. This is my office. It's been my office for 22 years, where I'm sitting, and it's in the basement of my home. And I came back downstairs and I looked at my client base and I thought, I can't work for these big businesses anymore, because they were the companies that I was helping do business development in, even if they were green cleaners. And so this was in 2003, I gave up around 95% of my revenue that I had worked for 9 years to build as a small business. For any of you who run businesses, I started in 94. There wasn't email, there wasn't internet. I busted my ass. And it was the best thing that I ever did. So one of the lessons that I teach people is, like, sometimes you have to let go of so much to just leave space for the best stuff to come in. And for the past 21 years that I've been focused really on conscious brands and businesses, I've just met the most incredible people that have changed my life. I've trained in many things, from Chinese medicine to tapping and trauma-informed therapy, and I'm a Reiki master and all these things, but I don't like titles. It's just who we are. And so as I go, I gather this stuff. And in 2021, when we were in lockdown and everyone was separated, and I was like, I have to bring everyone together. How can I do this? How can I bring us together? I opened the Wellness Intelligence Collective. And that is my online community space. And I say it's mine because I created it and I host it, but it's really co-created by everyone. And what is in there? So I'll just zip through what's in there so you guys understand. I hope anyone that's listening does join. There is no charge. This is my work and service. Leah's in there, so I know Babz is in there, so they can vote for it. There are no algorithms. There are no ads. I want you guys to show up for yourselves, and also shortcut one thing, just meeting the right people for your journey. And not everyone is the right person for you, but at least be exposed to all of that. So in 2021, I brought people in. I have every single week, I have the same pattern of content. On Mondays, I teach something called a lesson in empathy economics. That's not all honey is created equal. Not all essential oils are created equal. Not all socks are created equal. Whatever it is, you get this lesson and you look at it, and it's either for you or it's not for you. It doesn't matter, right? But you glance at it. It's for you or it's not for you. You might learn something. And it's not about me promoting or being an affiliate or selling a certain essential oil or not. It's about saying, here are the questions to ask when you're looking. Here's awareness that you can have as you go through your day. And you're choosing anything from relationships that you're in to products you're buying. Every Tuesday, I teach in alternating weeks, either a self-care snack or an exercise snack. For those of you who are on and listen to Parent, I already messaged her about that tongue and the exercise that she ran for us. They are that short and that profound. I have hundreds of them. Leah has taught both self-care snacks and exercise snacks. Babz has also taught one. And I do this to try and introduce you not just to a movement pattern or a self-care practice, a mini one, but also to a new person, because many of you might take yoga, might have a Pilates person, might have a lymph person, but actually broadening and widening your lens and exposing you to more teachers, more guides. You never know what rabbit hole you'll find that are the solutions for you, things that can help you. Every Wednesday, I share a favorite thing, which is not always a product. And I always say, we have to stop adding things into our life all the time. Sometimes we need to subtract. But people are really excited over knowing products, what products I use. So that could be anything from facial cups or different tools to help with your lymph system, but it can also help with your water filtration. It can help with pillow that you sleep on, because all of these things at the end of the day are going to help your lymph. If they're going to help your mind, body, soul, every single one of them. And I say why I like them, and they're only things that I personally use. And I usually introduce you to the human behind the brand, because if you're buying a pillow, it's not what's the best pillow. There's a million bests. It's, is this pillow good? Why is it good? Why is it not good? And who's the person? I always say I filter everything through empathy economics, which is trace back what you're buying to where it came from the very beginning. And if you feel good about it, it's good. It doesn't matter what anyone else says, but ask the questions and trace it back to where it came from. And every Thursday, I do an interview with one, what I call good human, a kind human. Again, Leah has been interviewed, and it's like everything she does is both entertaining and educational and inspiring. I do them in a written format, which is it shows my age, right? I started doing this before podcasts and before blogs. I did it actually to help my clients write their About Me page, because passionate entrepreneurs love, like Babz you're doing today, showcasing all of us. But is she talking about herself? And she's selling herself? So that is still my job, but that is an original job of mine, which is helping people write their About Me page who don't like to talk about themselves. I've interviewed everyone from my 3 kids and my 101-year-old grandmother to people who own sustainable hotel chains, who own manufacturing businesses, a 9-year-old kid, anything. So the reason why I do them in written is because I find they're still really digestible. Also, I don't know about you guys, but I don't have a lot of extra time in my day. And so this way I can read an introduction, I can skim some pictures and decide if it's interesting enough to me to spend the time. And that's how the week goes in the Wellness Intelligence Collective. It's all open. It's all no charge. Again, there's an upgrade to key membership that gives you access to some of my courses and all of the archives. So hundreds of these lessons and snacks. And that's something that I'm offering for being part of Babz's community. If you just use her name when you request to join, I will approve you, and then I will send you a guest link for that month. No problem.
Awesome.
Did I cover enough?
Yes, that was perfect.
14 minutes, something like that.
Spot on. You did amazing. Yeah. And that's why, Lisa, that's why we love you. And that's why I want you to come on this, because yes, everyone kind of has their little niche, but you are like a encyclopedia with all the niches. Like, you bring us all together, and that's how I initially met you, was doing the snacks, which I think is so unique and so amazing, because you're showcasing all of these different things that you actually believe in too. And I think that's a key ingredient to what you do and who you are as a person, that you show like, I trust this person, I like this, and this is going to help. And so you're a really good person to follow, a really good person to know. So I'm so happy that you came here today, and that my community can be connected to all of the things that you do. So thanks so much.
Thank you for having me. And as I said, anybody who brings people together, my kind of people, and that's really, we just have to show up for each other a little more. I always say everything that I write about is stuff that I've learned along the way. I'm always sourcing where it came from. And the reason why I do these exercise snacks, and like you're doing in between each session, Babz, they're so good, because when I teach one a week, and it's like, we forget sometimes how much stuff we know, but we have to bring it back and hold each other accountable for it. So it helps me too. Everything that I do really helps me as well. So
that's called occupational balance in OT.
exactly.
So that's great. Awesome. Thank you so much. Okay, let's see. Amy, where are you? There you are. I'm going to spotlight you. Hi, Amy.
Hi.
So Amy is one of our very own community members. So many of you know Amy already, but she hopped on last minute, which is amazing because I think I could spend maybe 2 hours talking about Amy and all the things that she does. But let's take a moment to ground ourselves, and then Amy, I'll let you kind of dive in, okay?
That's great.
So we'll just, again, take a seat and just take some breaths and kind of allow all that information that Lisa just told us to sink in and absorb into us. So we're going to inhale through the nose. And as we do that, we're going to say, I choose. Exhale to let it flow. Inhale, I choose. Exhale to let it flow. And then we're going to open up our eyes, reach our arms forward, thumbs up towards the sky. And then we're going to inhale to spread the arms like wings as you lift the chin and the chest. And then as you exhale, draw your body and give yourself a nice little embrace. Inhale, opening up, check that tongue position. And then exhale, draw it in, opposite arm comes on top. One more time like this. Inhale, open yourself up, get everything moving. Exhale, draw it back in, hold in for a breath, just embracing yourself, sending a little gratitude to your body for being here today. And then you can release the arms down, blink open your eyes. We'll take a breath in and let it out. Okay, Amy, this is a perfect little segue to you to tell us a little bit about you, your story, for those of you who don't know you, and I'll let you take the floor.
Sounds great. Thanks, Babz. I love how you're grounding us in between each speaker just to give that little bit of pause and to come back to ourselves is so nice. Sometimes when you're at little conferences like this, it can feel like you're drinking from a fire hose because you're just taking it all in from all these different speakers. And it's been so wonderful to learn from everybody. I've been taking notes like crazy and lots of people I want to reach out to. Tell you a little bit about myself. I have primary lymphedema in my legs. I've had it in my left leg since I was 5, and then I have had it in my right leg since I was in my 30s. So now I'm bilateral and I match. And I've had it through all the ages and stages. Like now I'm a mom. I've got 2 kids who are 10 and 8, and I had it when I first started when I was 5, so gone through those teenage, adolescent, young adult years as well. So really bring that lived experience lens that I feel in some ways is missing to lymphedema self-care. And because in a lot of ways growing up through those phases, like so much was unknown as to what was really helpful for lymphedema beyond compression. And I felt like every time I went to see my physical therapist or my doctor, they tell me something completely different than last time I was there, because it was such a new area for them to learn about. Like when I was diagnosed as a kid, I think there was like maybe 3 other people in the whole hospital of Toronto sick kids who had lymphedema. So there wasn't even a lot of other families to talk to at that time about it. And when you have primary versus secondary, it's even more rare. And so that really inspired a place of advocacy. I had to learn to advocate for myself, but also just inspired to learn. I've always been a lifelong learner, just picking up books. It's kind of how I got started in my first career as a librarian, as I just loved to research and loved helping people and stuff like that. And so that kind of led me to, at one point, to herbalism, because I was so curious to find some books about plant wisdom and ancient plant wisdom. And I was always looking for anything that was out there that could help the lymphatic system. And it was in a book in a bookstore in Toronto that I picked up a book by Rosemary Gladstar and came across the term she was talking about lymphatic herbs called lymphagogues. And I was like, what? There's herbs that can specifically help our lymphatic system. And I was just like, oh, this is so interesting. So that sent me on a rabbit hole. Like what Lisa was saying, where I just did like a deep dive for many years, really getting to know different plants that are really helpful for lymphedema, and incorporating them into my diet, into herbal medicines, working with essential oils, making skincare. I worked as a herbalist for many years as my kids were little and just staying at home. And so that was an easy job to, well, not easy, but it was easier, I found, to stay at home with a chronic illness, with lymphedema, looking after my kids than going back to work full time. I wasn't able physically to do that. Then the kind of rabbit hole led me to Ayurveda, because herbalism kind of crosses over with some of that ancient medical system, which is just, if you translate the word Ayurveda, it means the science of life. And so what's behind it is really just to treat everybody as an individual. We each all have individual constitutions. So you might have heard terms like dosha. Everybody has a unique blend of that. You could have vata, pitta, or kapha dosha. And in reality, we all have a blend of those. You will have one that's possibly more dominant than the others, or you can have an equal blend of all three, and that's called tridoshic. And I found that so fascinating to learn about. And what was really interesting for me when I took a class with it is, in this 5,000-year-old system, like way, way, way back before, we could visualize the lymphatic system with some of our modern medicine technologies now, they thought the system of the waters of the body was the most important system. And when I read that, I nearly fell off my chair. It's just not something that, or it's taken a long time for modern medicine to kind of recognize that, hey, the lymphatic system does play an important role and is really important. And so that was really interesting, and it kind of led me on a bit of a rabbit hole too. And I took 2 different 100-hour trainings in that, to learn more about Ayurveda and just apply it to myself and see, like, does this help? And I found it really, really did. It really gave me that self-care structure, but also gave me a perspective of looking at my holistic well-being and seeing myself beyond just the disease of lymphedema, and constantly focusing a lot of our energy on fixing ourselves in a way, or trying to make our lymphedema better. You can sometimes get really caught up in that. And one of the beautiful things I found about Ayurveda was it really helps set your body up to support yourself throughout the day with, like, proper sleep, breathing, diet, skincare habits, and things like that were really nice and sensual and simple, but also just help my whole body feel better. It helped me create a better connection with myself, helped me build a stronger self-loving relationship, because you're really attending to that physical, emotional, spiritual, mental parts of yourself, not just physical, which sometimes the lymphatic or lymphedema self-care that we're taught from our health professionals is very physical focused. And, that's really helpful, because we do definitely have physical challenges with lymphedema, but I really appreciated this other lens of just like, well, it's more than that. There's other ways that you can impact the physical through emotional work, or through breathing, or through diet. It's not just that you have to do something physical to your body. It can be these other ways, like tapping into our vagus nerve, and breathing and calming our bodies can actually promote lymph flow and relieve your swelling without you physically doing something to your body. So I found that like so fascinating. I did that first, and then that led me to do my yoga teacher training, because over the years I'd kind of been going to yoga classes, even when I was working as a librarian. And it was when I was at home with my kiddos, with my firstborn, that I really kind of dabbled into kind of the online world of yoga, because I couldn't always leave the house to go to a yoga class. And so I had to find another way to include yoga into my life, because I found it so helpful for my lymph, but all mentally, just being a new mom, coping with that. And I started doing YouTube yoga at home, and it was really fun. And so that kind of eventually led me to do the yoga teacher training as well. And yeah, I found it super helpful. I love the offerings Babz has. I've learned a lot from her. I also kind of stumbled across it through another yoga teacher, Italy Wallace. I came across her book years ago called Lymphatic Yoga, and she wasn't teaching it from the perspective of lymphedema yoga. She had come from it from another injury and got really interested in the lymph system for helping heal herself on her own health journey, and then just kind of had created a program of lymphatic health and lymphatic yoga, and found that really helpful too. So yeah, there's lots of different lenses, and yeah, there's lots of different experts out there, and that's different people to learn from. And I love helping people with the self-care piece, helping you build a daily routine that can really help you support your lymphedema and help you feel like you have a toolbox. I found that to be one of the most helpful perspectives, is just to think, what are all the different things that can help me in these different areas, and also taking that seasonal lens, which I love from Ayurveda, of just like, how do I help myself through the different seasons, and when do I have flare-ups, and thinking about eating seasonally, because that has actually really helped my lymphedema as well. And it's just fun. It's fun to help you shift your mindset, and that you're part of nature. And that's an important piece for wellness, I have found for myself. So, it's a long-winded answer, but I hope that helps.
Well, that was perfect, Amy, because I think you're so special, because you have lymphedema, so you've been through all the physical tools that you've been given, but you, like someone mentioned in the chat, looking through many different lenses. Like, you have your Ayurvedic, you have your yoga, you have your herbalism, you have like all of these different components that you yourself have tried and that you love and you found that helped you. And it's so cool that you're now teaching others about it. And you have such a special way of teaching and sharing. I know we've collaborated on some programs together, and I know we will in the future.
Yeah, that was really fun. I think it's still on offer, but Babz and I did a course together last spring, and I taught kind of an Ayurvedic lens of spring. And then Babz had a yoga class for us that was aligned with that. And that was really fun to do together. I'd love to do another one for another season to help us through the different lenses, because yeah, each season can have different challenges for lymphedema. And like, for example, like some things that you just learn from that lived experience. And I always encourage people, and this is what I do for myself, is I take that integrative approach. It's not, you have to, just follow an Ayurvedic lifestyle and everything will be fine. Like, no, I follow that to include into my medical care. I still have a PT that I go to. I still have a massage therapist that I go to. I wear compression every day. I have a compression pump. I've taken lymphatic microsurgeries. I've had that done 3 times, and that's been helpful every time. But what I love about these other elements of, say, herbalism, yoga, and Ayurveda is just almost like filling in the blanks, but building that strong foundation too, of just something that you can come back to every day and give you a lens to be curious about your body and evaluate, was this thing helpful or hurtful to me? Like, did it make my lymphedema feel worse? Did it make my body feel worse? Did it make it feel better? And just kind of evaluating and thinking from an energy perspective as to like, oh, I wonder why that helped. And like just thinking about it. Because everybody's a little bit different. Some people, for example, like thrive in the summer and do okay, and others not so much. And they might thrive when it's fall. And that has a different energy. It's very light, it's very dry. It can be very relieving to our swelling at that time, where summer can maybe aggravate our swelling, can increase risk of infection, things like that. And you may like look forward to the fall and the winter. And yeah, Lisa said hope and possibility. Yeah, that's really what all this brought to me, because in some ways, like I really felt so lack of hope in my 20s as my lymphedema was getting worse and worse and worse, and I was getting more and more infections. And according to the medical community, I was a model patient. I wore my compression, I took care of myself, I did lots of exercise, but each time I got an infection, it made it worse. Like, yes, the antibiotics took it away and they were really helpful, but they sort of wrecked my gut, my skin. My emotions were all over the place when I was on antibiotics and afterwards. So I had to spend a lot of time repairing my gut in between basically antibiotic doses. And I found a lot of help in herbal medicine and Ayurveda for building that foundation of just like, how do I strengthen and diversify my microbiome? Like, it's not just in my gut, but we have a skin microbiome, we have an oral microbiome. And just how can I support that? And that's been really fun to learn about. And I love teaching people about that.
Amazing. Thank you so much for Amy for coming on and for sharing everything.
You're welcome. I didn't look at the chat at all because I was chatting, but did anyone have questions that I
No
should?
questions, just a lot of positive love and energy sent in your way.
Aw.
Awesome.
Okay.
Thank you so much. And all of your information will be sent to everyone. And yeah, I'm glad that you were able to join and share.
Yeah, in terms of offerings, like I don't have a course right now, but I'm hoping to offer one for the fall. I'm just sort of working away on that, but people can take group yoga classes over Zoom with me, and it's for people with lymphedema, and I have lymphedema, so I'm happy to help you accommodate that. I'm teaching an in-person class here in Edmonton for people with lymphedema starting this week, and just as a drop-in, and people can book one-on-one consultations, and I'll kind of walk you through self-care. You can also just book one-off sessions if you have like just a lifestyle problem that you want some out-of-the-box thinking. Happy to help with that too.
Thank you so much.
You're welcome.
Okay, let's see. Patty, are you on here? I think I saw you. Let me find you. There you are. How are you?
I'm good. How is everybody today?
Doing well, doing well. So we'll just spend 1 minute together just to recenter. And that was wonderful, Amy, sharing all that about Ayurvedic and yoga. So we'll take a moment just to center, and then I'll let you take it away, okay?
That's good.
We'll just place our feet on the ground again, sit up nice and tall. And as you inhale, we're going to lift our left arm and our right knee, and then drop it down on the exhale. Inhale, right arm, left knee, and then drop it down. So kind of just some marching, just getting both hemispheres of our brain to connect. It's just getting a little bit of alerting, awakening. One more time each side, breathing in and out. Breathe in and out, and then settle the arms into the lap. We're going to inhale for a count of 5. Exhale for 3. Inhale for 5. Exhale for 3. And then reach our arms up towards the sky. Give a little wiggle, a little shake, a little waking up. Grab your water, and then we'll get started. So welcome, Patty. I'm so happy that you're here. If you want to explain a little bit about yourself and your story, we would love that.
Yeah, thank you so much for having me. It's been wonderful to hear all the presentations. I might be a little different, and I have lipedema, and I also have lymphedema because I got diagnosed really late stage when I was 38. And so I had the additional lymphedema component as well. So they kind of call it a lipolymphedema, is what I have in my body. And early on, we were kind of advised that, exercise could make us worse. So we listened, we did all the other things that we were told with, MLD and compression and everything like that. And I was somebody who was very active before I was diagnosed. So for me, that was a really big shift to kind of stop that. But I had recently figured out I had this condition after giving birth to my daughter in the hospital. And it went from me having the body that I was used to having active all the time up until pregnancy, to the delivery, my leg shape changed drastically in a matter of, days. So for me, that fear was there, and it was a big part of my early life with the condition once diagnosed. And I did other things. I had always been very interested in body work and took somatics and yoga and Pilates and different things like that. And so I was trying to find other things I could do that maybe would be helpful emotionally. So I did like Reiki courses, and that really did help me with my emotional dealing with having a chronic condition. And then I got to the point where my mobility really diminished because I wasn't being active like my body was used to being. And at the time, my husband was a CrossFit instructor and a martial artist, and he was teaching people regularly. And I asked him what the workout of the day was, and he wanted to know why that would be and why I was interested. And I told him because a lot of my community members were falling and not able to get back up on their own. And that really was scary to me. My decline was very scary to me. And he said, we can do that. And we started incredibly gradually in CrossFit, very modified movements, standing push-ups on the kitchen sink and a yoga ball for doing some sit-ups, and very modified movements. And I started to feel better. I started to regain some strength. Getting my core strength, improved was a big deal. And I regained my mobility. And I said, I want to talk about this, but so many people were still being told it wasn't the way to go, that it could make you worse. And so I said to the people that I was involved with in the groups that I was in on Facebook, what do you think if I start like a fitness group that's very focused on movement?
But I stretched my back and I did splits and clicks.
I'm sorry?
At least 5 minutes.
Well, I think
5 more minutes in trampoline.
Oh, sorry. Is everything okay, Babz? I'm not sure if I'm still. I'm going to keep talking. I think I'm still live, Babz. If you could just give me a heads up.
I'm so sorry. I was muted. Oh my goodness. The internet, Zoom always has a way to humble me. You're fine. I was unmuting everyone, and then I got out of the screen. We're back. Go for it.
Okay, great. So basically what I learned is that I had to listen to my own body. I had to listen to what spoke to me about my condition. And so I started a group that was very focused on movement, but not a traditional type of fitness group type thing. It was more about supporting the members in moving in ways that felt good to them. We have people that are incredibly active and do, marathons and things like that. But we also have people who have mobility challenges who need to do things that are seated. So it's a very unique situation in where we come together to try to support each other. And for me, I got very curious. It wasn't just about how do I treat lipedema, because when I was looking up things to learn, it was very limited in what was out there. So I started looking at my body as a whole and what is lipedema? It's a loose connective tissue. And before that, it was called a painful fat disorder. So I looked up chronic pain and I looked up loose connective tissue. And I got very interested in how we deal with pain and the lymphatics behind that. So the two things that have always been really important in my journey has been my lymph system and making sure that I'm moving that, and also the fibrotic tissue component that comes with lipedema and how I can deal with that. And that's really where everything kind of began for me. And I became a very big patient advocate. We have a saying in our group, it's all or something. Something is better than nothing. And so sometimes we can kind of get in our head, if we want to do this thing, we have to do it fully to the best that we think it should be done. Or we have all these wonderful things that people have talked about today that you can do to help your lymphatics, but it can get overwhelming when there's so many options. What do I do? Which one do I do? Do I have to do them all every day? And it really became about tuning in and figuring out which things work for me. And if I only have 10 minutes, what can I do in that 10 minutes that makes me feel better, that makes my lymph move better, and keeps me emotionally in a good state of balance as well as physically.
All or something. I love that. That's really a helpful mindset to have. I see a lot of nice things in the comment about you and about everything that you've been doing. And that I think it's really inspiring, your story in general, but the fact that you were kind of told by, doctors who we trust and that we try to take their word for that you shouldn't be doing what you always did. And then you kind of took it upon yourself to learn from your own experience in your own body and trying this exercise. And now you're helping other individuals with lipedema or lipolymphedema to support them. So I really appreciate you coming on. And so you have a Facebook group. I know that. Is that where this community connects, or where can my community find your community?
Yes, so we have a support group. It is for lipedema patients. We do have some that have lymphedema only, but there's definitely a component that has a lot to do with lipedema in that group. We also have a public Facebook page and an Instagram page as well. So any of those, you can find me at Lipedema Fitness. And it's just such a supportive group. The not feeling alone on this journey, I think, is such a big component of being able to live, with this condition, not taking over your, I'm more than lipedema, so I want to experience other things. And I think when we get together and share and talk about just other parts of our life as well, and how we incorporate maybe what we're doing for our condition, because like when I'm at the park and I'm working out and I'm in my compression and I'm doing the specific lymphatic stretching to help before I get into my activity, that all goes into it, but I'm still out in the park working out and having an experience there too. So it's all, it's all about that.
Awesome. Well, thanks again for sharing everything. We have a minute or so if anyone has any questions, or if not, I'm sure that they'll connect with you via your email or your group. So I appreciate you coming.
Thank you so much.
I'm seeing love this, Patty, in the chat.
This group is amazing. I mean, the literal love that this community has for each other and the support is what's so key, I think. And it's really just come such a long way, and it's transcending between, I think, both lymphedema and the lipedema communities, which is really lovely.
I couldn't agree more. Awesome. Okay. So now we have two wonderful people coming on. Let's see. Juliana, are you on yet? Oh, yes, you are. I see you. I'll ask you to unmute.
Hi, can you guys hear me?
Yes, I can hear you. How are you?
Okay. I'm good. I scrambled around this morning, getting stuff ready to come meet a young Lymphy about an hour and a half away from my house to help his mom learn how to manage his leg. So that's where I am now. That's why I haven't been here this morning. But I wanted to make sure I'm here for this. And then we'll go swimming in the backyard. Two little Lymphies.
That's
I'm
all about you. That's like introduction of who you are. Just that experience alone, coming on and being like, well, I'm just out helping some Lymphies, now I'm gonna go help that is you. So
I'll
without even having to say anything else.
I'll show you guys the treatment real quick. I won't put him in the picture, but this is one of the treatments I use every single day for my leg. It's called deep oscillation therapy, and it helps basically break up fibrosis and drain the excess fluid from any inflamed area of your body, essentially any injury, post-surgery healing type stuff. It just brings healthy blood flow to the area. So I really wanted him to actually get to try it. So sometimes I'm Juliana. I have an Instagram that's LymphyFit, and I help a lot of people, a lot of patients online through just talking, or if they can't understand through text, I will do video calls or voice calls and help them do stuff. But sometimes if I can get to the patient, I will drive to them and help them, learn how to do what I do to take care of my leg, because I had no health issues. I played sports my whole life and then went to the States on a full ride for soccer and lacrosse. And in my freshman year, I got really badly injured. A girl landed with the back of her heel with cleats on the top of my foot, and broke my foot, damaged nerves. And that's what we thought the extent of the injury was. But the swelling started climbing up from my foot all the way up my leg. And then my leg was just this blue color, and it was horrible. And I played on it with my broken foot for the rest of that game. And then they looked for blood clots for 2 weeks and didn't find any. And it took them 8 months to really figure out from a full body MRI that my iliac vein was collapsed. And that's why my leg was blue. So by the time they got a stent in through my neck into my iliac vein down here, my lymphatic system was essentially already overloaded, already damaged. So I was 19 in the States. I'm from Canada. I live in Canada. So I wasn't around any family or anything. And I didn't know how to live with lymphedema. And I was playing 2 NCAA sports and majoring in chemistry. And I just couldn't give up on life. And I had no idea how to continue with life. But I refused to come back from the States when everybody at home watched me leave on a full ride, and I come back, 6 months later, like with a blue leg and quitting school, quitting sports. Like, that's how I felt. So I just kept pushing myself. And at the end of undergrad, my leg wasn't better. I had my degrees, and I had the choice of either moving back to Canada or staying in the States. And I realized Canada doesn't have the surgical options, and I'm doing as much as I possibly can to maintain my leg. So if I go back to Canada, this is all I got. So I decided to stay in the States for grad school. So I did my master's and my PhD at the University of Alabama while I did some surgeries on my leg, which had mixed results depending on the surgery. So my story's long and complicated, but that's kind of the gist of it. And then I made a Lymphy Instagram in 2016 just to try to find anyone else that had it. I didn't know anybody that had it. And I started to make a little community, and then the little community kind of kept growing. And then I met Dawn, who I'm not sure if he's on here, but we used to encourage each other by just sending each other like sweaty selfies and be like, I'm like working out, like go work out. So we'd encourage each other to work out. And eventually we would just say #sweat check. So that we would know that meant I'm working out, you go work out, move your limb, pump your leg, like we can do this. And eventually we started doing it on our stories, tagging each other. And then other people asked if they could be involved. And we're like, yeah, like this is an exclusive thing. So then Lymphies on our community online on Instagram would start hashtagging sweat check just to show like, I'm a Lymphy, I'm going for a walk today, or I'm walking my dog or swimming or whatever intentional movement to move the lymph around your body you're doing. If you post it on your story and you hashtag sweat check and tag me and Dom, we share it so that everybody in our communities will see it. So on bad days where I can't work out and I'm not very, I feel like I can't motivate other people, at least I'm able to share what other people are doing to motivate other people. So I found our online community is like really impactful when it comes to making connections and kind of learning the ropes of how to live with lymphatic disorder. And yeah, I'm in Canada now and I can answer any questions you guys have. I know I didn't prepare what I was going to say and there's a lot to cover. So I don't know if I should just wait for questions or if you have something specific you want me to talk about. I'm in this book. I'm sure they mentioned it earlier.
Yes. And that was perfect, Juliana. That was exactly what I was hoping you'd share about yourself and your story, which is quite amazing. And like when you first came on, you were like, yeah, I'm helping this person, this person. That's how I see you. And that's why I wanted to connect with you and Dom, because you are the two people you're both young too. And I think a lot of people maybe think of this diagnosis as an older person, or, there's different notions. So
the patient I'm helping right now is 14. So what I realized was that the younger people are able to function and hide. It's not that they don't exist. There is lymphy everywhere. And once you're out there, you start learning that really. I saw a question, my PhD, it's bioorganic chemistry, like enzymology studies.
I see a few questions. What treatment did you show at the beginning was one question.
Deep oscillation therapy. I have two machines because I bought a deep oscillation therapy by Physiomed from Canada about 12 years ago because my massage therapist was renting a clinical size one. She was doing my lymphatic therapy and she was crazy good at it because she didn't do traditional MLD. She realized my fibrosis needed some more pressure, needed different types of techniques. So we worked together to figure out what would work the best. And we found this machine. She rented it, ended up buying it, even though it was like 30 grand because she uses it on all her massage clients, even people that don't have lymphedema, because it relaxes everything and just helps blood flow. And it just is just an amazing treatment. And then my mom got me a second one. She kept my first one. So I got a new Physiomed one about 6 years ago. So I have those two. And then this company in China actually made the same therapy. This is the first time I've seen it in a different brand or anybody else make it, but they've called it electrostatic oscillation therapy as opposed to deep oscillation therapy. Both of them use electrostatic impulses to oscillate your tissues to help promote blood flow and healing and stuff. So I have two machines of the same thing, but the one that I got last year from the company from China, I've only had for about 7 months. So I can't speak to the longevity of that machine. Whereas the Physiomed one that I've had for 12 years, both are still functioning well. And all that we've had to replace are like the cables when they get old or the electrode pads. What is deep oscillation therapy? Okay, I'll get the machine so I can kind of show you. I'll explain it.
We love a field
So
trip.
yeah. So the one machine, I'm going to show you the Physiomed one. That's the one we're doing on his leg right now. So here is the machine, and it has different frequencies, and you connect 2 wires to it. So one wire will be connected to the person doing treatment, like on their skin, like just an electrode, and then the patient has an electrode as well. So it's like a continuous circuit. And then you just do lightly, see if they can hear the buzzing. You guys hear the buzzing?
A little bit.
Yeah, so it's very, very gentle. It's really hard to hear, but it's very gentle and very effective. So it's not like stim where you're putting an electrode on and you're using electric stimulation to contract your muscles. It's more of just a very gentle wave going through your tissues up to like 8 centimeters. So depending on the frequency it's set at, it will penetrate a certain amount of depth in your tissues. So if you're at the higher frequencies, it's going to be very superficial in like the superficial skin layers. So typically you start with like a higher frequency around 120 to stimulate the lymphatics in your neck, around your collarbone, armpit, side, groin, and then you start working on the leg from the top down, always going in the direction of towards your heart. And then it is my favorite part of the deep oscillation. Like obviously it helps with daily drainage of fluid. My favorite part that has helped me maintain my leg the way it is, which people just think my leg's not that bad, but my leg's extremely stubborn and awful. And as soon as I take compression off, you're watching it swell. So I can show you guys my leg, what it looks like. And it's only like this because I've had deep oscillation for 12 years and I work on it every day, like as much as I can. So there's not that much difference between my legs, but it's because of the maintenance I do on it. And a lot of that is deep oscillation.
Thank you so much for sharing that. That it's something that I feel like the more tools, the more education, the more knowledge, and also, like you said, your management of your leg is because you work so hard at it. And I think that the one thing that I would encourage my participants here to reach out to you through your email, through your Instagram, and use that sweat check hashtag, because when I saw that, I was like, that is so key, because we've talked all day about community.
15 minutes.
Once
you hear me start talking.
Make sure everyone's muted. So I think that's huge, because when I see you and Dom together, yeah, I don't see that Dom's here, but I have his information here that everyone can learn and connect with him. But with you motivating back and forth is so helpful. And I see in the chat, you're a powerhouse of knowledge and applying the tools, etc. Love the sweat check community. And wow, this is great to see how you're using your knowledge in the isolation therapy. So oscillation. So, awesome. Thank you so much for joining.
Yeah, so I have my email and my Instagram. If anybody has further questions, want to ask me, feel free. I'll be here.
Thanks so much for everything you do.
Of course.
Okay. So
Bye,
let's
guys.
see. I see Jean's here, I believe.
Yes, I'm here.
I'm gonna spotlight you. So hi, Jean, welcome.
Oh, thank you, Babz. Thank you for inviting me.
So before we dive into all about you, I've been taking just a minute to center everyone, to do some breathing and a little bit of movement, just because it's been a information-packed day. So we'll just do that, and then I'll let you take it away. So we're just gonna sit up in our chairs for a moment, close our eyes, and just place our hands in our lap. Let your shoulders relax. And then we'll take a slow breath in through the nose. And then a slow breath out through the mouth. And then we'll take one slow neck circle in one direction, or you can just stretch your neck if the circles don't align with your anatomy. So just going nice and slow in one direction. And then when you're ready, we'll take a slow neck circle in the other direction. And then your next inhale, we'll reach our arms up towards the sky, and then we'll push the walls away. So spread the fingers wide, and we're going to push the walls away as we drop all the way down. Inhale, reach your arms all the way back up. Exhale, push the walls away. And then reach the arms up towards the sky. Do a little wiggle, do a little shake, wake up the body. And then we'll relax the hands down. And Jean, I'll let you take it away. I know many people from my community are already very familiar with you. So we share a lot of mutual participants, which is wonderful. But I'd love for you to share just a little bit about yourself and who you are.
Yeah, thank you. Yeah, and I think, as you mentioned, we share a lot of students in our various programs, which I think are what we offer is just so complementary. It's lovely. So thanks again for inviting me. My name is Jean Lamantia. I'm a registered dietitian. And for those of you who aren't familiar with that profession, it means I have a bachelor's degree. I have an honors degree in applied human nutrition. And then I completed a clinical dietetic internship. So a dietetic internship, in my case, was done at a teaching hospital. And it's about learning how nutrition impacts different disease states. So you would work, for example, 2 weeks in cardiology, 2-3 weeks in nephrology, internal medicine, pediatrics, like all the different rotations, and you learn all the different therapeutic nutrition strategies. So that's my sort of my educational background. And then I worked as a dietitian in Diabetes Education Center. And then I was diagnosed myself with lymphoma, which is lymph node cancer. So the lymph nodes in my neck, under both arms, and in the middle of my chest were affected by my cancer. So I had a tumor, was 15 centimeters in the middle of my chest. And what I want to share about that experience is, when I was being diagnosed with cancer, and many people who are listening maybe have been through this, you go through the staging, right? And all the pre-tests before you start your treatment. And one of those tests, a bone marrow biopsy, I showed up to the hospital. I could hardly breathe. I was so short of breath. And what was happening is that my lungs were filling up with lymphatic fluid. And essentially I was drowning in my own body is what was happening. Now, the treatment for that, I could just have it tapped out. So they did a thoracentesis and drained all that lymph fluid that was accumulating in my lungs through my back, and made me certainly deeply appreciate my lymphatic system and what it does. Because, certainly I didn't learn a whole lot about it in my training. And then I went on, I won't get into all the details on my professional journey, but I did start practicing in oncology, which is cancer. And I was approached by a lymphedema therapist to join her clinic here in my area. And she worked a lot with cancer survivors, as well as it was a lymphedema clinic. And then I started hearing about lymphedema. And certainly I remembered my own experience with my lymphatic system. And I really started thinking, yeah, this is an area where I can use my skills and my training to look at the research and see how I can help people. Because at that time, there was no guideline for nutrition for lymphedema. And so I'm happy to say I'm actually in the process. I'm working with the National Lymphedema Network to write the first position paper on nutrition to manage lymphedema. And along the way, I wrote this book. You may be familiar with this, The Complete Lymphedema Management and Nutrition Guide. Sorry, I blurred my background, so you can't really see it. How do I get you to see it? Anyway, that's it right there. There. So I wrote this with a lymphedema therapist, and I offer programs like Lymphedema Nutrition School, which is an amazing small group class, much like the classes that Babz teach, except that we're talking about nutrition and nutrition strategies and setting goals and trying out new strategies and evaluating how they affect the lymphedema, and just keep going with the ones that are working and then adding new ones. And it's a 10-week program. So as you can imagine, there's new things to try every week. And it's a great way to become part of a very supportive community as well. Because I think having lymphedema, you oftentimes might feel like you're alone, you're by yourself. So this is a great way to stay connected, even though it is over Zoom. It's really lovely. Did you have any questions for me, Babz, or are there any questions in the chat that are directed towards me or towards nutrition?
Yeah, we can definitely open it up for questions if anyone here has any questions, but I just want to talk about Jean for a minute. I love her, as many of my participants know, because Jean has come on every single program that I've run. She's come on to share about nutrition, and it complements my program so much because, as you all know, we talk about yoga, we talk about all different kind of physical exercise, mental health, but the nutrition is a key component of managing lymphedema and lipedema. And if you just go to Jean's website, jeanlamatia.com, you'll see how much she's put into this and how many blogs she has, how many topics she discussed. Honestly, any topic you can think about, she's either wrote a blog about it, has a post about it, or if not, she will research it and she will find it out. So I just appreciate her so much for everything she does for our community, and the fact that she really cares in finding the science behind things and backing up what she shares with us. But I see in the chat someone says hi, Jean. So
Yeah, I saw that. Hi, Robin.
any fans here.
Yeah, thank you, Babz. And I agree. It's a great compliment because, especially if you're quote unquote compliant patient with lymphedema. So you're doing your complete decongestive therapy. So it's your exercise and your skin care and your manual lymphatic drainage and you're wearing your compression, but you think, boy, I wonder what else I can do. So then maybe you discover Babz and you learn about lymphatic yoga and how to move your lymph using yoga. So then you add that. And then you still might be thinking, well, what else could I be doing? Like, is there anything else? Well, then you add on nutrition on top of that and try out many of the different nutrition strategies. You're like, it's even better, right? So there's definitely, I don't want you to despair because there's a lot of tools that you can use. It's not just complete decongestive therapy, which I know is the foundation, but there's so many complementary therapies. And I heard Juliana before talking about, a therapy that she uses. I think she was talking about, was it endermology or bioresonance? So there's a lot of different things that you can do. And that's actually something that I look into quite a bit on my platforms. So Babz mentioned that I blog. So some blog topics. I've got one on lymphoria, which is where the lymph fluid leaks out of the skin. I've got one on serapeptase, which is an enzyme. I've got one on different herbal supplements. I've got one on selenium supplementation. I've got one on castor oil for lymphatic drainage. I've got one on phlebolymphodema, like anything that you can think of really around lymphedema, like a red light sauna, and just regular like heat therapy. And yeah, Babz mentions that she likes that I research things. Like that's who I am. Like I'm a nerd. That's it. If you look up nutrition nerd, you're going to see my picture in the dictionary because that's who I am. And I really like to, research things that people are talking about. Like if everyone's on about essential oils for lymphedema and you have to use them, I don't want to just pass that information along. I want to go actually do the research and look up, see what's been published and then share without bias, right? Like I don't have a horse in that race. Like it's not like I want to sell you essential oils or something like that. I don't. I just want to give you the information. I'll give you the both sides of it, the pros and the cons. And if I think it's working, I'm going to tell you. And if I think it's, promising or it's not working, not worth your time, not worth your money, I'll just put it out there. Yeah. So that's what I like to do. So definitely if you like to know what's in the research with a non-biased voice, definitely check out the blog. And I've got some webinars coming up. If I can share, I've got one on July 11th on the anti-inflammatory diet. This is a protocol that I recommend for everyone with lymphedema. So if you want to find out more about that, then definitely join. It's free to join because it's a sponsored event. And if you go to my website, you'll see somewhere at the top, it'll say webinars or other courses. If you click on that, you'll go to my courses. And then I just had an amazing one on aqua lymphatic therapy. So a specialist, she's actually from Israel, did a webinar talking about how to move through the water when you have lymphedema or lipedema to get the most benefit. And there's a couple really neat things that I learned about that. And there's a download that goes with it. It shows you the protocol, basically, how to move your lymph if you have upper body or lower body, what to do when you get in the pool. And I'll give you a hint, it's not swimming lanes. Okay. That's not the best, most effective way to use the water. And I have one coming up in August on reflexology lymphatic drainage and another workshop I'm going to do on complementary therapies. of which yoga is one, of course. Yeah, so that's more about me and all the resources that I have available. So these are out there and I'm making them for you. I don't even have ads on my blog, so you can go there and read it. You don't have these things popping up and advertising to you. So that's all there. And my courses, some are free, some are low cost, and some are a little bit more investment, like the ones that are more involved. And I invite you to check them all out. Yeah. I forget where to look for update research going on re-diet and lymphedema. Learn. Yeah, you could certainly look at Learn. You can look at my own blog, or if you have questions, email me, and I can also look into it and do research on it. And yeah, because recently I did something on what is it called? Chyle leaks, because I had somebody, I was talking to them and they had a chyle leak. And so I wrote a blog on it because I wanted to, explore not just what it is and how it happens and the treatment, but also the nutrition. What are the nutrition strategies for chyle leaks? And it turns out there's a whole protocol for it. So those are the kind of things you can find on my blog. But yeah, I'm happy to keep providing great content and answering people's questions and really letting you know that nutrition is a key part of your lymphedema management.
I agree. Yeah, awesome. Thank you so much, Jean. And I'm sure once my community watches the replay of this, your email might be flooded.
Okay. That's what I call a good problem to have, right?
Yes. So thank you for everything you do. And we really appreciate you coming on today and continuing to support all of us.
Yes. Well, thanks for including me. I'm very proud to be part of this this group. I'm honored that you would select me to be part of this collection of resources to show off to your community. And what a great idea. And hopefully people continue to take your course as well, Babz, and to follow you, because I know you're really doing some amazing work. And when we do sessions together, I'm always looking at the chat, and of course you always take people through a live experience, and the chat is always full of, oh my gosh, I didn't think it would work that fast, and oh my gosh, I can feel it moving, and all those things. So I know that your program is very effective.
It's so hot.
Well,
Do you want my flippies?
hold on.
You sure?
I do have some 52 cards.
Sunscreen?
Hey, Mom. Want to mute yourself?
Yeah, Dave.
Classic Mom. All right.
Thank you, Babz.
Jean, I appreciate it.
All right.
Cool. Good. Okay, let's see. Katie, are you here yet? You are. Yay.
Hi,
How are you?
I'm great.
Let me see. I'm just gonna add you here. See spotlight. Okay. I'm just putting you there. Good. So we'll take just a moment just to ground. If you just hopped on, that's what I've been doing in between each person, is just a moment of mindfulness. So we'll do that, and then I'm excited to introduce you to my community. So we'll take a moment just to sit up and let your shoulders relax and let your face soften. And then take some slow breaths in through the nose. And then out. And then we'll reach our arms out like wings, so out to the side. And then we'll bend the elbows to cactus the arms. Spread the fingers nice and wide. We're going to inhale here. Exhale, twist towards the left. Inhale back to center. And then exhale, twist towards right. So getting just a little bit of trunk rotation, a little bit of movement. And then reach the arms up towards the sky, stretch the arms up, and then we're going to draw our elbows down into the side ribs. Good, inhale, stretch the arms up, reach up. Exhale, nice, one more, breathe in. And out. Awesome. Hi, Katie. I'm happy that you're here.
Thank you. I'm glad to be here.
I'll let you share a little bit about yourself and who you are and anything you'd like.
Okay. Well, my name is Katie. I'm an occupational therapist. I was researched my lymphedema certification many years ago. I would say it's been, I think it's 17 now. And then I received an oncology rehab certification. So the first part of my career has been focused on oncology rehab, really helping men and women recover and try to return to their life before a cancer diagnosis. I started my own practice a year ago, and I then realized how many women out in the community and in the world are struggling with lipedema. And being in a hospital setting that was focused only on oncology, I did not realize how many women were suffering. And so I have really tried to spread the word, spread education, evidence-based treatment ideas on how to manage lipedema.
Awesome. Yeah. And you recently started your own YouTube channel.
Correct. Yes. So if anybody knows me or has spoken to me in person, I am very tech challenged. Just, clicking on the Zoom link. Took me a minute. So yes, using social media as a way and different platforms to reach more women, more medical professionals, to educate not only on lipedema, but lymphedema and the lymphatic system in general. So yes, I have a YouTube channel that I've started, and it can be anything from recipes to yoga to lipedema to lymphedema, but really trying to use that because I know, as for me personally, I've used it for years. I love to get on there and do different exercises, yoga, how to do technology. And so YouTube can be a fantastic free service for people to learn from. So that is something that I'm trying to grow and try to, again, use as a platform to educate the communities.
That's excellent. I know, and a couple of your videos are kind of like short, like warm-up videos, or kind of like things that people can fit in through their daily lives too, which is really helpful.
Right. Yes. So, I work, I have a family, I have 3 kids, I have a dog. Sometimes that is all I can get in is I find like a 5-minute video, 3-minute video, or even just remembering some of the things that people have taught me and then trying to incorporate that into our day, because managing any chronic disease such as lipedema or lymphedema, it is tough and it can be overwhelming. And so knowing that just a few minutes of, yes, deep breathing, a little bit of stretching like we just did, can make a difference in our day-to-day life and how we feel.
Completely. And do you want to share a little bit about your guides?
Yes. So I have put together multiple free resources, and typically I get these ideas from people that reach out to me, like multiple people with the same question. So one is my 101 Speak Lipedema guide. And so that is kind of the basis of lipedema. And again, being an occupational therapist and a lymphedema specialist, very evidence-based. But just like to wrap your mind around what it is, we hear all sorts of conservative tools, which can be great for people. What those are, knowing that not every conservative tool is going to work for every individual, so you have to kind of play with it. So that is hopefully to get people started, if lipedema is a diagnosis that's new to them. The doctor's spreadsheet, again, people have reached out. Do you know anybody over here? Or, in Florida, I live in Missouri / Kansas. And so I'm like, oh my goodness. So just putting together a list of doctors that people have, where I've learned about them, and putting it all in one place so that you can try to, find somebody in your area to help you. Not necessarily surgeons for lipedema, but just somebody who knows something about lipedema. Because sometimes that's the first step is, okay, this is honestly what I have, and now I can start to take the steps further to manage it. And then the third one is my top 3 favorite compression garments for lipedema. Very common question I get. Which one do you like? There are so many out there. And so putting those 3 together will, again, hopefully get women started on some ideas, some options. And I will tell anybody that it's like buying a pair of jeans. Not every pair is going to fit like you want. And sometimes you have to try it. And once you put it on, you figure, okay, that's not what I'm looking for.
That's awesome. That guide with all like the doctors or the resources, that's key, right? Because a lot of people are kind of like, where do we begin? Where do we start? And
Right.
I
Yeah. Or just even getting that diagnosis code. I have met multiple women just struggling, like, I just need this diagnosis code so I can move forward with my insurance, so that I can clarify or get clarification on this is the diagnosis I have. And that can be so frustrating when you're at home and you don't have the medical professionals locally to help you.
Do you have any questions for Katie in here in the group? I know a lot of participants are going to be watching this afterwards too.
For
but
sure.
Share those the guides if you want to send them to me, or if they how could they find those guides?
So they're on my website, or they're also on my Instagram link tree. So they can click on that and get to the guides. Would probably be the easiest way to get a hold of those guides.
Awesome. Thanks so much for joining, and keep doing what you're doing. You're building
Yes.
a good platform and some key information. So I
Thank
really
you.
appreciate you coming on and sharing.
Yes. Thank you for inviting me. You have, like I said, I love your videos as well, and what a great community you have. So hopefully, as a collaborative, we can help lots of people out there.
And I'm seeing in the chat, thank you for your guide. So I know that's going to
Aw.
be big here. So
Good.
spread awareness of those, because that could be, like you said, just getting the diagnosis and finding somebody who can connect you. And it's really
Right.
important for insurance purposes, for even just like your mental health journey, or emotionally, to have a diagnosis is sometimes key.
Yes, that unknown, and questioning yourself, because we can all kind of spiral with the unknown, and then our mind is constantly
There's one above it. I guess.
so that can be tough.
Thanks so much, Katie.
You're welcome.
Good. So I'll let you introduce yourself and anything you'd like to share, and we can dive right in.
Okay. Welcome everyone. My name is Cecily Braden, and I am the founder of Cecily Braden Spa and Wellness. I am an esthetician and an educator, and in the course of all that have become somewhat of an innovator, just developing tools and techniques to meet the demands of the work that I do, whether it's educating people for facials or developing tools that are going to allow me and the people I'm working with just an easier way to facilitate the movements and get the results that they want. So I am celebrating 30 years in the spa and wellness industry. And so it's been kind of a crazy and wild ride, but I really love the space that I'm in now, and working with lymphatic drainage, and everyone that I've met along the way, and all the paths that have been opened up through the lymphatic work, which is much broader than the beauty and the spa and the I want to say like cosmetic, but it has kind of a different meaning, but kind of the spa and wellness industries. And I'm really appreciating all the information that I'm learning, and having the ability to participate and kind of share what I have to offer as well.
Awesome. I know some of my participants have the lymphatic brush, but could you share a little bit about how you created it? I personally love it. I have the smaller one and the larger one, and it's the softest thing I think I've ever felt. It's very, very, and especially with good right there. Yep. I would love for you to share kind of like how it came about and what's the design and just all about it.
Yeah, so kind of starting with the end of the story first, the lymphatic brush, kind of from concept to launch, took about 3 years to develop. And I had the idea to create a tool that was specifically designed to work with the superficial lymphatic vessel system through all of my other work. So I began creating protocols and teaching. I really developed my first facial massage protocol back in 2003. And it was with the herbal poultice, which is a small compress, has a little hand, almost looks like a little mushroom. And my light just went out. And it looks like a little mushroom. And I designed it, or I developed a protocol for facial massage. And that really came through my work with the larger herbal poultice for the body and for what we call the head neck recovery treatment using the cranial herbal poultice. And from the body treatment and kind of an abbreviated version with the cranial poultice, I started to notice all kinds of different changes in the face. And so I thought, you know what, there's really something to this, because I noticed that there was a reduction in puffiness. The contours of the face were unearthed, right? We would see lifting and dark circles disappear, and puffiness would lessen. And so I thought, you know what, there's got to be something to this. So we created a smaller herbal poultice, which is the facial poultice now. And I started to develop techniques using that for facial massage. So it took me about 2 years. And looking back, it's kind of funny. It's just everything has come full circle. And it's really taught me a lesson in just staying on my path and letting my heart lead the way. As I developed the herbal poultice facial massage protocol, one of the techniques was called pump and pull. And it's a horrible name, and I've challenged people over and over if they'd like to rename it. Sometimes we call it tug and tilt. And it's a specific technique with the herbal poultice. And it was the most effective technique using that for, again, reducing puffiness, getting rid of dark circles, just the overall, improving the overall complexion, reducing stress, everything. So with that, I taught that for about 12 years before I did anything else or was introduced or added any additional tools into it. And so with that, I was introduced to gua sha, and I wish I had an herbal poultice here, but I don't. I was introduced to gua sha stones. And from the herbal poultice, I had developed a full range of techniques, pump and pull being one of them, but not all of them, for facial massage. And with that, I wasn't an esthetician at the time. I was mostly teaching massage therapists and body treatments, and it was really for relaxation. So I lost my train of thought. So what happened is I was teaching this range of techniques that I ultimately transferred to use with a series of gua sha stones. And I expanded my course offerings, and we call it Gua Sha Facial Fusion. And that's really my core class that I teach. And it fuses multiple modalities, gua sha, lymphatic drainage, some different connective tissue manipulations, and all of the techniques that I had developed using the herbal poultice. We kind of just transfer it from the herbal poultice to the gua sha stones. And one of those techniques was, in fact, the pump and pull technique, because it didn't matter if you were using the technique with the poultice or the stone or a spoon, it was all about engaging the tissue and creating this slight little shift in the skin, and then kind of manipulating the fluids forward. And so the technique was, again, one of the most effective techniques. And it wasn't until I took an MLD course in 2016 did I really have that aha moment where I realized that this pump and pull technique, the one that I have been teaching for 13 years, and that I know to be one of the most effective techniques, was actually, in fact, manual lymphatic drainage. And so I had that aha moment at an MLD class, and I thought, oh, this is pump and pull. And so the name really makes more sense because we pull the skin a little bit, we get that slight little stretch and shift in the skin, and then we manipulate and move it forward, propelling the fluids, and thus reducing inflammation and all the puffiness and getting all the fluids flowing. So it was kind of cart before the horse. And I had developed all these techniques. And when I found out that it was manual lymphatic drainage, then of course we labeled it as such. And I could dive a little bit deeper into the science behind it and understand exactly what we were doing in regard to manipulating the superficial lymphatic vessel system. So that's really where my education began, even after I had been teaching and preaching these techniques for many years. So fast forward, in doing that, this technique was actually one of the most difficult techniques to teach professionals. It was the portion of the class where the learning curve was the highest. It was very difficult getting the pressure correct, getting the movement correct, getting just all the elements perfect. And so, we really practiced on that in class, and then it came down to the client level. So here we are on a 3 and 4 day hands-on course where we spend it in quite a bit of time on this one technique among others. And then it came down to professionals really incorporating that into their facials and not forgetting it and being able to properly replicate it once they were out of class. But then it trickled down to clients. And that's where it really, I guess, kind of what led me to the lymphatic brush, or, kind of put that fire, or created the urgency to do it. Because it was one thing for professionals to do the technique, but then it was another thing for them to be able to teach clients in a short amount of time, and then have clients be able to replicate that at home, whether it was with a tool, with their hands. It was just a very difficult process. And that technique and the benefits of it were being lost. And myself, I found myself in a space where, people would come to me and say, oh, what do I need? I have puffiness here, or I have acne here. I have this condition or this concern or this concern. And, as an esthetician, I would look at them and I would say, you need lymphatic drainage. Like, it always came down to, I know what you need lymphatic drainage, and there's nothing I can do to help you, because I can give you a gua sha stone to use for lymphatic drainage techniques. Gua sha is not lymphatic drainage. You can utilize a gua sha tool to mimic the lymphatic drainage movements, but it's very difficult to learn and do. And I found myself in this space where I kept telling friends and people, like, I just don't have anything for you. Like, I don't want to sell you a tool because I know you're not going to use it. I don't have the time to teach you. It's very difficult. And even if you're using gua sha in a gua sha sense, which is manipulating the connective tissue and focusing on blood flow, right, which indirectly is going to support the lymphatic system, it's still not lymphatic drainage. And this is still not exactly what you need. And so I just kept finding myself in this position of not having anything for therapists and their clients to effectively and easily incorporate lymphatic drainage into their professional or personal routine. And so I guess as the saying goes, you know, just out of need and necessity, I developed the lymphatic brush. And it took me a while, but the inspiration was that pump and pull technique using the herbal poultice. And then it was through years and years and years of teaching lymphatic drainage with a gua sha tool. And so this, I have to tell you, is so much easier. And from my courses, everyone says it's a lot more fun. It's definitely a lot more fun to teach. It's fun, you know, it's easier to use. And then of course, the important part is trickling down to clients who are using at home. Because in the end, that's where we're going to help more people, when we can take it from the clinic to people to incorporate at home, because maintenance and just the management of fluids and the buildup and everything that cascades from there is a big part of it. So kind of a long answer to a story, but it really has been about, I don't even know, about 20 something years in the making.
Wow, I really appreciate you breaking that down for us, because that makes it even more special in my mind, because you found that there was a need, you didn't have a tool to do this, and then like you said, our ultimate goal is to help the most amount of people we can. So if we can't have our clients, our patients, our participants doing these tools for themselves, then we're not reaching this goal. But you are, like, this is really neat that you're able to have this brush. I'll welcome any questions in the chat, but something, I think one question that we might have is, how does your brush differ from, you know, one that I could just buy on Amazon, or besides the texture, obviously, but what kind of separates the two?
Oh gosh, a lot of things. I actually didn't know what I was getting into. I thought, okay, finally something that's going to be easy to manufacture and something that's going to be easy to produce. And it actually has not been that easy. So there's a couple things that are kind of, I guess, specific to the lymphatic brush, but also specific to its effectiveness. And that is a combination of the density of the bristles. So it has, I kind of call this the foundational base. And there's a specific density to this base. There's also a very specific curvature to this arc. And then, of course, the added texture of the bristles. So all of this together is kind of the culmination that creates the effectiveness of it. And so what we're doing is we're using these textured bristles to engage the skin in a very precise way at a very precise level, right? That's not too deep, not too soft. So, you know, we're not just brushing the skin, right? Because that's not effective. That's like using a smooth roller, right? You have to engage the tissue in order to create change. And this is something that we really focus on in my classes, and also even with clients, because, you know, clients are like, oh, I don't want to stretch my skin, I don't want to move anything, but the skin needs movement. It needs to be engaged. And it just depends on what level of engagement and what the pressure is and what the intention is behind it. And that's going to change the outcome. So you might have a specific technique, change the pressure, right? Which changes the intention and the outcome. And it might be the same technique with a different pressure and a different benefit. So the intention is important. So one of the things with lymphatic brush is the ability to use those little nubs to engage the tissue, to kind of grip. So we're engaging the tissue and creating that slight shift that is needed to help propel the lymph along the vessel system. In order to propel it, to kind of push it, everybody has a different name for when they're using the brush and what's happening. But what's what my goal was is we needed to have something that would grip the skin, have it be gentle. Dry brushing was not an option for a lot of people. Dry brushing can be very painful, and it doesn't work for the techniques that I teach in class and for the facial massage treatments. And it's not as effective because we're not gripping and manipulating the vessel system. So we can grip just as we would with our hands, and manipulate it. So just kind of a couple of techniques. One is when we engage the tissue, we just have the gentle sweep, right? Which is creating that shift. And you kind of see the shift in the skin of my arm. Difficult to see here, but you can kind of see it rebound there. So this provided an easy way to create that shift and rebound, that stretch and rebound that was needed, without a lot of education. It wasn't a traditional dry brush, although it's used on dry skin because of the texture, okay, and the density. And when we change, if that combination changes, it actually changes the effectiveness. Now you can take the brush and you can do different techniques, right? So we can do something that's like a stretch, rotate, release, stretch, rotate, release. So we can kind of get this two-way stretch in there and really work a lot more with specific needs, and maybe, very stagnant areas. You can do this pumping motion, right? We get this static pumping where we're really helping to break up this congestion and get things flowing and kind of soften that fluid that becomes very gel-like and what I call kind of spongy, or like little, I work along the face and we get a lot of it feels like little gummy bears right underneath the skin. So, areas where there might be some fibrosis, you can get in there and go a little bit deeper. So that would be with the larger brush. It's excellent for the neck. It covers a lot of territory. With your hands, you're limited a little bit. And although you can mimic what you do with the brush with your hand, again, it's harder if you don't have a more specific or vast knowledge or deeper understanding of the pressure and what you're doing. So this, all you have to do is connect the bristles and it gives you the precise pressure, and all you have to do is just sweep. So it gives you that natural stretch and rebound that's needed without anything else. So I can literally just tell people, just sweep, right? They're like, I don't know what I'm doing. I don't know how to do it. Just connect the bristles and sweep, and you're going to get that natural stretch and rebound. So, and then as a professional, you can use it with additional techniques and kind of, as an alternative to working with your hands. I've had a lot of professionals say that it's a lot more efficient in some areas, that, they're able to do, cover a lot more territory in a shorter amount of time. So that's one, there's a range of techniques. It's easy to do. And the other that was really important to me is that you can't overstretch or damage the skin. So with the traditional dry brush, the focus is increasing circulation, right? Which is going to increase that tissue fluid and the tissue pressure. And with the lymphatic brush, we can remove the excess fluid, and we can remove, kind of isolate the lymphatic vessels without increasing blood flow. So dry brushing is about increasing circulation, and this is not. This is just about reducing the inflammation and focusing on removing the excess fluid without increasing blood pressure. And so in that's a very stark contrast when you start talking between dry brushing and lymphatic brushing, because we are focused solely on the movement of lymph, and dry brushing is focused on blood and blood flow. So those are two very distinct contrasts. And then techniques. And then when we look at the difference, the larger brush has a shorter, more dense foundation and base, and the smaller brush is has longer bristles, and that's so that it can fit and contour different shapes. Not everybody's face is the same. And so what we wanted is something that would have a little bit of splay or flexibility to be able to contour any facial type. Some people have more angular jawline, some people it's a little bit more pronounced. Maybe it's, fuller, has a lot of fluid. And because the key is connection of the bristles with the skin, then we needed something that could fit the different features and structures of the face. So these, although they look the same, they are different. And in producing it, we just approved, after rejecting 4 production samples. We rejected 4 because if this is off just by a couple millimeters, or the arc is not specific, it doesn't engage the tissue exactly as needed. And I found that out. I do blind tests. I test these blindly, and I can tell with a blindfold, close my eyes, they shuffle up all the tools, and I pick out the ones that have the specific density, texture, and firmness that I need without being too firm, because we don't want circulation. It just has to be, we're not trying to stimulate any circulation. So when we say it's very precise, it's very precise, and that equals the effectiveness. So it's not like we just put a bunch of bristles into a base and we're like, voila, here you go. It's down to the actual millimeters with and half a millimeter when it comes to the density and the texture and how many bristles are in that base. So it's quite a lot, actually.
That's super helpful to know, the science behind it and the manufacturing and what it is. Thank you so much for sharing. This has really been very educational, and I hope that all my participants see the difference now and see all the work that you've put into it. It's years and years of your education and your expertise in this. So thanks for joining, and thanks so much for sharing. And so this is all your contact info. I'll make sure everyone has your email and your website. And thanks again for giving the code, the 10% off for the brush, which is awesome.
Yes, absolutely. And we're adding one of the things that I mentioned at the beginning and is really exciting is that the lymphatic brush has launched us into different industries and different arenas that I never thought I would be a part of. And one, it's introduced me to you and like so many people in the lymph community. But even outside that, I have customers tell me they have clients with Parkinson's that it's been effective for. Autisms, there has been ADHD, working with obviously lymphedema related, post-cancer rehab, but all kinds of arenas, pre and post-op, for plastic surgery, and all these different arenas that have opened up. And I realized more and more and more that everything comes down to inflammation. A big part of it is inflammation. And so, from, being an esthetician, we focus on inflammation because inflammation causes a lot of skincare concerns. But now we really go beyond the face, and we're able to just by stimulating, even if we're just working, from the décolleté up, we're having this profound amount of effect and benefits on the entire body. And that's been really exciting. And it just really shows us the power of the lymphatic system. And, before, when I kept telling my friends and people, you just need lymphatic drainage, that's even more profound now because I know of the resounding health benefits that I can say, yes, this is definitely what you need for those puffy eyes, for those dark circles, to help with your acne, but also for your overall health and well-being. This should be a part of your daily routine and focus. right? And then other things trickle down from there, and the resounding health. But I'm really happy to be part of, working with people who are working with and having to help manage lymphedema. And it's just, that's been really rewarding as well. And it definitely has exceeded all my expectations.
Awesome. Thanks again so much. I look
Thank
forward
you.
to collaborating with you in the future.
I do as well.
Okay, let's see. This is our last speaker of the day, actually. Everyone, you made it. Let's see. Jill, I see that you're on here. I'll add you as a spotlight.
Yes. Hi.
Hi, how are you?
I'm good. I'm good.
Good. We'll just take a minute to breathe together, and then you are closing up the celebration of this offering day. So thank you so much.
No word. No, love it. Thank you.
So let's just start by placing our feet on the ground, maybe inching your way to the edge of your chair. And then we're going to inhale, reach our arms up towards the sky. And then exhale, draw the hands down through heart center. And then keep the palms together. We're going to inhale, push those palms together as you reach all the way up. And then exhale, draw them back down. We'll do it 3 more times. So inhale as you reach the arms up. Keep the palms together. Stretch the arms. Exhale as you lower. 2 more. Breathe in. And out. 1 more. Breathe in. And out. Okay, Jill, you can take it away.
Hi. Well, thank you so much for having me. I joined for the last presentations, which I'm already going to sign up and take advantage of that brush. I need it for my eyes. But I am Jill Coleman. I am the Sales and Education Manager for Prairie Wear. I have been with Prairie Wear since February, but I'm going to share a little bit of my personal journey because I think, Babz, that's what you asked for. I found out about Prairie Wear. I don't know how many people on here know who they are. I found out about them a year ago, July. I was sitting at a conference with an industry colleague. My past is I did fit and sizing for the apparel industry. I worked for Tags and Labels, but I am an 11-year lymphedema breast cancer survivor and have suffered for 11 years with lymphedema and didn't talk about it. You just did what you had to do, and you found therapists that would help you for a little bit, but nothing that you just lived with the garments that I didn't know about, right? So I was sitting at this meeting and I was talking to a gentleman. He's like, "Hey, have you heard Prairie Wear?" I'm like, "No, I haven't." So he connected me with Holly Markwell. She is a CEO, so I'll build in some of the company history. It's a women-owned business out of Canada. And she started in the construction business, but just wanted to get a team of people together to work on a garment that was better for the body and better for the planet. They didn't know what it was going to be, but they wanted to work on something. Back in 2014, they had a need that one of their oncologists industry colleagues came in and said, "We need a better garment for somebody that's having breast surgery and dealing with coming out of the operation." So they went to work finding the best threads, the best yarns, the best garment construction, the best designers and surgeons involved. And hence Prairie Wear, the Hugger, was born. So I started using this product. There was 3 at the time: the Prima, the Vita, and the Luma. And they said, "Just try it." So I put on the Prima, which is like the big vest. This is our truncal right out of surgery. It's the workhorse. It's 100% skin safe, OR ready, moisture wicking. I don't want this to be a sales pitch, but it's like, I put this on after 11 years of suffering. And I was like, oh my goodness, the hug I got and the relief I immediately got after I wore that for like a week. And then I put on the Vita and then the Luma, which is my favorite. It's kind of the workout. these are my go-to bras all the time. I live in South Florida. Sometimes I have to wear strapless, but as soon as I'm done with that event, I put these back on. But I think what fast forward in February, they were looking for someone to, help them grow this business. And I'm like, why not me? I am just the product itself. And I think the previous speaker was talking about how much time and energy was to design a body-friendly product is an amount of love and work. The zoned and map compression, it's where the anchor points are not on the breastbone, it's underneath. It's one measurement, so it's getting your lymphatics always moving. And I know I feel like I'm rambling, but I'm just like so passionate about the product. And then the fourth one we have now is the Aria, is your everyday. But we want to put people into something that you've been diagnosed with an issue. You're working with a therapist, but this is your maintenance. This is a tool for your toolkit in every stage of your journey, whether you're coming out of surgery, whether you're starting your everyday going to the market, you're working out, there's the Luma for that, and then the Aria if it's your everyday lounging around. But it giving you that zoned and gradient compression where and when you need it. And the shoulder straps, the other thing too is that it's dual layered. So the compression, whether you've had a bilateral or wherever your part is, it doesn't move. Like that's the second layer stays with you, so that if you're flat on one side and bigger on the other, you still get the needed compression when and where you need it. So I'm going to pause there, Babz. I think I'm running on no coffee.
No, it's very helpful. And I wanted to invite Prairie and you to meet my community because I really trust these bras and these compression. And I was just introduced a couple months ago, and the customer service and the actual company is wonderful. Like everyone who I talk to in your company is so kind and really is in this for the right reasons, like you are. And I have tried them all on myself. I now have them in our clinic, and I'm now getting insurance to cover them. And I'm really, every individual who comes in with either breast lymphedema or breast cancer treatments, I'm ordering them one of these bras. And I'm like, here, try on all these and see what you like. And I really hope to see one day that this bra is a standard of care, because it really is so important to have the proper compression and the proper material, even that it's high up on the armpit. And so I could go on and on like you could too, but so thank you.
But I think too, one of the key is that you go for treatment, and I know your audience is from people that are using it or medical professionals, but it's really to help the medical community with the patient. Putting you in the right garment right out of a surgery makes a big difference, so that you're not having that. You're having swelling, but it's in the right places, and you're making it go down. And I think the difference with the huggers, and we call them huggers for a reason, because you feel like you're getting a little hug no matter when you're wearing it, is that the material is Okotex Standard 100. It took almost 4 years to develop the first Prima. And because there was a lot of love in that, the yarn and the thread all go in the same direction. So if you put a garment on one of your patients or yourself and you start getting a red mark, not a compression mark that you're trying to reduce, but a red mark, that's killing the skin. And it means that it's not going in the same direction that you need. You're in the wrong size or you're in the wrong garment. So that's one of our rule of thumbs. The other thing too is the way that they've done the shoulder straps is that they do not slip. So we say, if you're in the medical field, the medical community, we want you to wear these bras yourself, because this is an everyday go-to bra that if you're doing a surgery and your bra strap slips down, they're not going to stop a surgery. It's going to be irritating, but it's we've had professional people that know their breasts and the body itself with the surgeon. They know right where the pressure points are not. So it's sitting where you don't even know you have it on. So I think that's, one of the, I can hear Holly in my head now is like, this better for your body, one thing, right? It's skin safe. A baby, you take it right out of our bag and you can put it in your mouth. Like you're not going to get sick. All the components, we created a little garage for the zipper in the front. All three of the three bras we have are the front closures with a little clasp to help people, a G hook to help people that need to get it around. You can put it over your head. It stretches. You can put chip bags inside. You can put breast forms. The Prima is our unisex where you take the modesty pads out, and then it's great for the truncal for a male. We've got several male patients, and even someone has some broken ribs. They put that on. They're like, oh my God, I'm already feeling better about it. So it's moisture wicking. To me, I think the biggest thing I see is I don't see these bras defined by a diagnosis. I see these as everyday. No matter where you are, like we've got some of our law enforcement people trying these on, how they're wearing them underneath their bulletproof vests. They're like, oh my God, we sweat, but we're not wet, because it's taking that moisture away from them. It's giving them that snug and compression where they need it. They know that they feel safe in that garment underneath a bulletproof vest. So I think this is just exciting times here. And I think what you hit on is all of these products are covered under the new Lymphedema Treatment Act. There's the right codes, and I think that is a big key. And we have on our website here, we'll show what hugger is right for you. We now have 4. The latest one we literally got it like shipped last week. It's called the Aria. It's our first front closing, back closing bra with it goes up to the size 3X. It stretches. We have done probably it was 3 years in the making for this particular garment. Everybody wanted a little bit less compression, but still have enough that it's covered under the lymphedema and helping you as you heal through your journey. Because as someone has said, once you have lymphedema, it doesn't go away. You can reduce the symptoms and the pain, but to have 4 different products that helps you through where you are in that journey. And sometimes you might get a flare up. And so for me, I put my Prima back on when if I'm flying or doing something, I'll put that back on, and then I'll go back down to my Luma or my Vita. But a lot of work and love has been put into these products because it came from a need, right? And I think that's why I love the prayer wear, the vibe. We want to, if you're not happy, let us know. We want to make sure that we're getting your patients into the right product. So I don't know what else you need.
No, that was perfect. Thank you so much. And I encourage everyone to check out their website, follow them on Instagram, and and just get familiar with these bras because they're fantastic. And I'm so happy that you could come today and share about them. I really appreciate you joining.
Yeah, and we have a lot of resources. We have a great little 2-minute, 1-minute videos on our YouTube channel that talks about each one, what need. And if you have a specific issue or need, please reach out. We get back to you pretty much the same day, but we have a lot of education material and we're here to help. And we just appreciate you inviting us to this because we, like you, it's a community of support, right? And if our product isn't the right, we can recommend something else for you as well. But the big thing is getting help, ask for help. We're here and continue to support you.
Awesome. So the email, the Instagram, the website's all listed here, and I'll make sure that everyone receives this and also all the information to connect with you. Thank you so much, Jill.
No, thank you.
Okay, great. We did it, everyone. You made it through. Made it through our community offering day and our 6-week Lymph Flow Yoga Wellness program. So I made a QR code here that you can take a picture with your phone that will link you to a Google Doc, and that has all of our community's offerings in this doc. And I also will send out this PDF of the PowerPoint presentation, so you'll have that as well. And I'll also send you all of the recordings from our program. But I just want to open it up just for a few minutes just to say any final words from any of our community or any questions. But I love you all so much, and I'm so happy that we got to spend these last 6 weeks together, and I've had a blast, and I've learned a lot from all of you and from our community today. So thank you. And so I'll stop my screen share, and then we can chat. Thank you all so much for joining my 6-week yoga wellness program. Today was such an amazing day with all our participants, and I feel just so overwhelmed with love and happiness that all of you are here and that you're going to watch this recording and continue to learn from it, grow from it, and continue just to digest its information from this past 6 weeks and continue to reach out to me, stay connected, and I will see you soon.